Everyone, on behalf of National Institute of Mental Health and Neurosciences, Department of Epidemiology and Center for Public Health, I welcome everyone to the gathering. And at the outset, I would like to welcome our director, Dr. Pratima Murthy, who has been a strong support for us to conduct the stakeholder meeting as well as all the activities of the department. Welcome to you, ma'am. I welcome the very well-known Dr. B.R. Ravikantegoda sir, who is the Joint Commissioner of Bangalore Traffic Police. And just now you were saying he took responsibility for the Bangalore traffic, but we don't hold you, sir, because 70% of it is because of the commuters. And we welcome you, sir. And Shri Gnanendra Kumar, the Additional Commissioner and Member Secretary, Karnataka State Road Safety Authority, is here. He was very welcoming for this stakeholder consultation. And for this to happen today, we have with us our former senior professor and former director of NIMANS, Dr. G. Gururaj, who is a well-known name within road safety and injury prevention. We welcome you, sir. And we have speakers and officers and office bearers from within the John Hopkins Bloomberg School of Public Health, Bloomberg Initiative, and many other prominent stakeholders, including the Bangalore Traffic Police representatives and our very own from the same fraternity, Dr. Asha Abikar, Aparajita, everyone. So welcome all of you, and I would keep this brief so that we have time for the technical consultations as well. Welcome to everyone, including the media. Thank you very much. Thank you. So I request our director to say a few words as opening remarks. Madam, okay.
Dr. Ravikantegoda, Joint Commissioner, Bangalore Traffic Police, Shri Gnanendra Kumar, Additional Commissioner and Member Secretary of the Karnataka State Road Safety Authority, Professor Gururaj, our former director and former senior professor of epidemiology, my colleagues from the Department of Epidemiology, Dr. Nishit Patel, the Research Associate at the International Injury Research Unit at Johns Hopkins, all the other invitees to this particular program, and most importantly, all the functionaries responsible for road safety in Karnataka. Gives me great pleasure to be here on this discussion on road safety risk factors in Bangalore City. This is a very interesting and exciting program because you're going to be discussing not just the factors that are associated with road safety risk and looking at the assessment of the various risk factors in the country, and also looking at some of the observational factors for road safety in Bangalore itself, looking at how the methodology of this particular research was carried out, what are the recommendations from it, and of course, how do we take it forward? We've just been discussing the kind of sometimes the road safety nightmares that exist in urban cities. So I think this is a very, very important issue to discuss. We also know that road traffic injuries and fatalities are a major public health concern in our country. And it costs our country nearly 3% of the GDP. Nearly 1.3 lakh persons die due to road traffic injuries in India. That's the statistics for the last year. And for every person who dies, about 30% of them have serious injuries. And sadly, many of them come to NIMANS, particularly the ones which occur in and around Bangalore. And because of the number of cases that we get, we're simply not in a position to handle all the grievous injuries that come to us. Therefore, of course, one thing is, of course, treating it once a problem occurs, but it is much better to go upstream and try and see what are the road safety measures that we can actually develop so that the incidence itself comes down and people are generally safer. In Karnataka, a couple of years ago, statistics, we had about 34,000 and odd road traffic accidents and about nearly 10,000 people who died in these accidents. COVID, with all its problems, also brought about a little respite in the fact that actually injuries came down. In fact, alcohol-related injuries also came down, which is an area that I work in. And in 2021, of course, there was a 22% decline as compared to previous years, thanks to COVID. There are several safety factors which can reduce road accident risks, apart from helmet use, and that's something our institute has talked about for so many years under the leadership of Dr. Gururaj. Seatbelt use, drinking and driving, as well as overspeeding. These are the four major factors that are responsible for more than half to 60% of all road traffic incidents. Unfortunately, the risk factor data is only limited in the current system, and there are probably other risk factors that we haven't accounted for. So it's important to look at that. And our Department of Epidemiology has been constantly associated with work in this area. We've been the WHO Collaborating Center for Injury Prevention as well as Safety. We've developed the Traumatic Brain Injury Registry, the Bangalore Surveillance Project, Injury Surveillance Project, the Trauma Care System development, the helmet legislation, related advocacy and policy support. And these are some of the key contributions, again, under the leadership of Dr. Gururaj. This observational study has been jointly conducted by the Department of Epidemiology, along with the Johns Hopkins International Injury Research Unit, and is supported by the Bangalore Traffic Police. And therefore, this, I hope, will become part of a larger government initiative, which will then be taken forward, and other departments like the Department of Transport, the Government of Karnataka, the Bloomberg Initiative will all get together to take this program forward. And in this study, I think more than 2 lakh vehicles, 2.2 lakh vehicles have been observed, which is very, very huge in number. And they've looked at roads as well as vehicles which have been randomly selected based on the population density and the GPS coordinates. And in this, because of the nature and the magnitude of this, possibly become one of the largest surveys on road safety risks in Bangalore city. And the objective is to assess the distribution in terms of the key road safety risk factors and utilize this information for road safety programming and policy making. And hopefully, NIMHANS has always been open to such collaboration. So this is very exciting. I think after a bit of a lull, particularly because of COVID, to take this forward is very exciting. So I know there will be other partners that I may not have mentioned who are here in this audience. And I hope we can all work together. Sir, I don't know how you're going to reduce the density of traffic on the road and how you're going to make the roads wide enough to deal with it, because Bangalore is just bursting at its seams. But surely I think we must make sure that whatever it is, both in Bangalore and other parts of the state and the country, we certainly must address all the risk factors which adversely affect road safety and make the roads a safer place to travel in the country. So such initiatives are very welcome, and I look forward to the deliberation, and I'm sure we can all work together. The Bangalore Police and NIMHANS has a strong affinity for various reasons, all the good reasons usually, to improve the citizens' health and safety. So I'm sure this is going to be one more such initiative, and I wish this conference all success. Thank you.
Thank you very much, ma'am. I now request Dr. Ravi Kantegowda, sir, Joint Commissioner, Bengaluru Traffic Police. Sir, ಒಂದೆರಡು ಮಾತು.
ಬೆಂಗಳೂರಿನಲ್ಲಿ ರಸ್ತೆ ಸುರಕ್ಷತೆಗಿರ್ತಕ್ಕಂತಹ ರಸ್ತೆ ಸುರಕ್ಷತೆಗೆ ಧಕ್ಕೆ ತರ್ತಕ್ಕಂತಹ ವಿಷಯಗಳನ್ನ ಕುರಿತು ಮಾತನಾಡಲಿಕ್ಕೆ ಇವತ್ತು ನಾವೆಲ್ಲ ಇಲ್ಲಿ ಸೇರಿದ್ದಾರೆ. ಈ ಸಭೆಯಲ್ಲಿ ಇರ್ತಕ್ಕಂಥ ನಿಮಾಸ್ ನಿರ್ದೇಶಕರಾದ ಡಾಕ್ಟರ್ ಪ್ರತಿಭಾ ಮೂರ್ತಿ ಅವರೇ, ಅಡಿಷನಲ್ ಕಮಿಷನರ್ ಮತ್ತು ಮೆಂಬರ್ ಸೆಕ್ರೆಟರಿ ಕರ್ನಾಟಕ ಸ್ಟೇಟ್ ರೋಡ್ ಸೇಫ್ಟಿ ಅಥಾರಿಟಿ ಶ್ರೀ ಜ್ಞಾನೇಂದ್ರ ಕುಮಾರ್ ಅವರೇ, ನಮ್ಮ ನಾವು ಯಾವಾಗ ನಮ್ಮ ಗುರುಮೂರ್ತಿ ಅವರೇ, ಯಾಕಂದ್ರೆ ಯಾವಾಗ ಅವ್ರ ಜೊತೆ ನಮ್ಮ ಅಸೋಸಿಯೇಷನ್ ಜಾಸ್ತಿ, ಮತ್ತು ಎಲ್ಲ ಡಾಕ್ಟರ್ ಗೌತಮ್ ಅವರೇ, ಡಾಕ್ಟರ್ ಪ್ರದೀಪ್ ಅವರೇ, ಮತ್ತು ಎಲ್ಲ ನನ್ನ ಸ್ನೇಹಿತರೆ ಮತ್ತು ನಮ್ಮ ಸಂಚಾರ ಸಿಬ್ಬಂದಿಗಳು ಕೂಡ ಬಂದಿದ್ದಾರೆ. ಯಾಕಂದ್ರೆ ಅವರಿಗೆ ನಿಜವಾಗಿ ಗೊತ್ತಿರುವಷ್ಟು ನನ್ಗೆ ಗೊತ್ತಿಲ್ಲ. ನಾನು ಬಹಳ ಫ್ರಾಂಕ್ ಆಗಿ ನಿಮ್ಗೆ ಹೇಳ್ತೀನಿ, ಅವರು ಕೂಡ ಇಲ್ಲಿಗೆ ಬಂದಿದ್ದಾರೆ. ಇದು ಬಹಳ ಚರ್ಚೆ ಆಗ್ಬೇಕಾದಂತ ವಿಷಯ. ಯಾಕಂದ್ರೆ ಬೆಂಗಳೂರಿನಲ್ಲಿ ಒಂದು ದಿವಸದಲ್ಲಿ ಕನಿಷ್ಠ 2 ರಸ್ತೆಗಿಳಿದವ್ರು ಮನೆಗೆ ಹೋಗಲ್ಲ. ಇನ್ನು 10 ಜನ ಕೈ ಕಾಲು ಮುರಿದ್ಕೊಂಡು ತಲೆಗೆ ಏಟ್ ಮಾಡ್ಕೊಂಡು ಮನೆಗೆ ಹೋಗಲ್ಲ, ಆಸ್ಪತ್ರೆಯಲ್ಲಿ ಇರ್ತಾರೆ. ಅಂದ್ರೆ 2 ಜೀವಂತವಾಗಿ ಮನೆಗೆ ಹೋಗಲ್ಲ. 10 ರಿಂದ 12 ಜನ ಅವರು ಮನೆಗೆ ಹೋಗದೆ ಇರ್ತಕ್ಕಂಥ ಸ್ಥಿತಿಯಲ್ಲಿ ಆಸ್ಪತ್ರೆಯನ್ನು ತಲುಪ್ತಾರೆ. ಇದನ್ನು ನೆನೆಸ್ಕೊಂಡಾಗ ಈಗಾಗಲೇ ಡಾಕ್ಟರ್ ಪ್ರತಿಮಾ ಅವರು ಹೇಳಿದಾಗೆ ಈ ದೇಶದ GDP-ಯ 3% ನಷ್ಟವನ್ನ ಈ ರೀತಿಯ ಅಪಘಾತಗಳು ಉಂಟು ಮಾಡುವುದ್ರ ಜೊತೆಗೆ ಯಾವ್ಯಾವ ಆ ಕುಟುಂಬಗಳಿದ್ದಾರೆ, ಆ ಕುಟುಂಬಗಳ ಜೀವಮಾನವಿಡೀ ನೋವಿಗೆ, ಆ ಕುಟುಂಬಗಳ ಜೀವಮಾನವಿಡಿಯ ಆ ಸಂತಾಪಕ್ಕೆ ಕಾರಣವಾಗ್ತಾ ಇದ್ದಾವೆ ಈ ಅಪಘಾತಗಳು. ಇದನ್ನು ತಪ್ಪಿಸುವ ದೃಷ್ಟಿಯಿಂದ ಕೈಗೊಳ್ಳಬೇಕಾದ ಕ್ರಮಗಳ ಬಗ್ಗೆ ಈಗಾಗಲೇ ಹೇಳಿದ ಹಾಗೆ ಬೆಂಗಳೂರು ಸಂಚಾರ ಪೊಲೀಸರು ಮತ್ತು ನಿಮಾನ್ಸ್ ನಾವು ಸತತವಾದ ಸಂಪರ್ಕದಲ್ಲಿದ್ದೇವೆ. ನಿಮಾನ್ಸ್ ನಾವು ಒಂದು ಎಕ್ಸ್ಪರ್ಟ್ ತಜ್ಞ ಸಂಸ್ಥೆ ಅಂತ ತಿಳಿದು ಅವರು ಕೊಡ್ತಕ್ಕಂಥ ಸಲಹೆಯನ್ನ ಬಹಳ ಗಂಭೀರವಾಗಿ ಸ್ವೀಕಾರ ಮಾಡ್ತಾ ಇದ್ದೇವೆ. ಯಾಕಂದ್ರೆ ನಿಮಾನ್ಸ್ ಇರ್ತಕ್ಕಂತಹ ಒಂದು ಸಾಮಾಜಿಕ ಕಾಳಜಿ, ಅವರು ಕಳೆದ 2 ದಶಕಗಳಲ್ಲಿ ಮಾಡಿರ್ತಕ್ಕಂತಹ ಸಂಶೋಧನೆ, ಅದರ ಫಲಿತಾಂಶಗಳು, ಅವುಗಳೆಲ್ಲವನ್ನ ನಾವು ಅಧ್ಯಯನ ಮಾಡಿ ಅವ್ರು ಹೇಳ್ತಕ್ಕಂಥ ಸಣ್ಣ ಪುಟ್ಟ ಒಂದು ಸೂಚನೆಗಳು ಸಹ ಅನೇಕ ರೀತಿಯಲ್ಲಿ ಈ ಅಪಘಾತಗಳನ್ನ ಕಡಿಮೆ ಮಾಡುವುದಕ್ಕೆ ಸಹಾಯ ಮಾಡಿವೆ. ಈ ಹಿನ್ನೆಲೆಯಲ್ಲಿ ಈ ಒಂದು ಚರ್ಚೆ ಏನಿದೆ ಇದು ಬಹಳ ಮುಖ್ಯವಾದದ್ದು ಅಂತ ನಾನು ಭಾವಿಸಿದ್ದೇನೆ. ಎರಡನೇದಾಗಿ ಇವತ್ತು BBMP ಚರ್ಚೆಯಲ್ಲಿ ಭಾಗವಹಿಸಿಲ್ಲ. ದಯಮಾಡಿ ಮುಂದಿನ ಚರ್ಚೆಗಳಲ್ಲಿ BBMP-ಯನ್ನ ಕರೀಬೇಕು ಅಂತ ನಾನು ಕೇಳ್ಕೊಳ್ತೇನೆ.
ಇಲ್ಲ ಸರ್,
ಅವ್ರು ನೋಡಿ, ಇದು ಬಹಳ ಗಂಭೀರವಾದ ವಿಷಯ. ಯಾತಕ್ಕೆ ಈ ಮಾತನ್ನ ನಾನು ಹೇಳ್ತೀನಿ ಅಂತ ಹೇಳಿದ್ರೆ, ಇವತ್ತು ರೋಡ್ ಸೇಫ್ಟಿ ಫ್ಯಾಕ್ಟರ್ಸ್ ಅಂತ ನಾವೇನು ಬ್ರಾಕೆಟ್ ಅಲ್ಲಿ ಹಾಕಿ ನೋಡ್ತೀವಿ, ರಸ್ತೆ ಸುರಕ್ಷತೆಗೆ ಧಕ್ಕೆ ತರ್ತಕ್ಕಂಥ ಅಂಶಗಳು ಅಂತ ಏನ್ ಹೇಳ್ತೀವಿ, ನಾವು ಅದನ್ನ ಕೇವಲ ಯಾರು ವೆಹಿಕಲ್ ಅನ್ನು ವಾಹನವನ್ನ ಓಡಿಸ್ತಾರೋ, ಚಾಲನೆ ಮಾಡ್ತಾರೋ ಅವ್ರನ್ನ ದೃಷ್ಟಿಲಿ ಇಟ್ಕೊಂಡು ಮಾತ್ರ ನಾವು ಮಾತನಾಡೋದಕ್ಕೆ ಪ್ರಾರಂಭ ಮಾಡ್ತೀವಿ. ಆದ್ರೆ ನನ್ನ ಅನುಭವ ಮತ್ತು ನಮ್ಮ ಸಿಬ್ಬಂದಿ ಅನುಭವ ಏನು ಅಂತ ಹೇಳಿದ್ರೆ, ಒಂದು ಒಳ್ಳೆಯ ರೋಡ್ ಮಾರ್ಕಿಂಗ್ ನನ್ನ ಪ್ರಕಾರ 30% ಅಪಘಾತಗಳನ್ನು ತಪ್ಪಿಸುತ್ತೆ ಆ ದಿವಸದಲ್ಲಿ. ಉದಾಹರಣೆಗೆ ನಿನ್ನೆ ನಾನು ಕಣ್ಣಾರೆ ನೋಡಿದ್ದನ್ನ ನಿಮ್ಗೆ ಹೇಳ್ತೀನಿ. ನಮ್ಮ ವಿನ್ಸರ್ ಮ್ಯಾನರ್ ಸರ್ಕಲ್ ಇದೆಯಲ್ಲ, ಅಲ್ಲಿ ನಮ್ಮ ಒಬ್ರು ಅವರ ಬಹುಶಃ 28 ರಿಂದ 30 ವರ್ಷದ ಮಹಿಳೆ ಹೆಲ್ಮೆಟ್ ಹಾಕಿದ್ದಾರೆ, 2 ವೀಲರ್. ಅವರು ನೇರವಾಗಿ ವಿಧಾನಸೌಧದ ಕಡೆಗೆ ಹೋಗ್ಬೇಕು. ಅವರು ತಪ್ಪಿ ಅವರು ಬಲಭಾಗಕ್ಕೆ ಅಂದ್ರೆ KK ರೋಡ್ ಕಡೆ ನಮ್ಮ ಆ ರಸ್ತೆಗೆ ಹೋಗುವ ರಸ್ತೆಗೆ ಬಂದ್ಬಿಟ್ರು. ಅವ್ರ ಹಿಂದೆ ಒಂದು ಬಸ್ ಇದೆ. ನಾವು ನೋಡ್ತಾ ಇದೀವಿ, ಇವರು ಆ ಬಸ್ಗೆ ಕೈ ತೋರಿಸ್ತಾರೆ. ಬಸ್ಗೆ ಬಹಳ ಹತ್ತಿರದಲ್ಲಿ ಕೈ ತೋರಿಸೋದು ಗೊತ್ತೇ ಆಗಿಲ್ಲ, ಎತ್ತರದಲ್ಲಿ ಕುಳಿತಿರ್ತಾರ. ನಾನು ಇವರು ನಮ್ಮ ಕಣ್ಣೆದ್ರೆ ಒಂದು ಅಪಘಾತ ಆಗೋಯ್ತು ಅಂತ ಹೇಳ್ತೇನೆ. ಆದ್ರೆ ನಮ್ಮವರಲ್ಲಿ ಇದ್ದವರು ಆ ಬಸ್ ನಿಲ್ಲಿಸಿ ಅವ್ರನ್ನ ಕಳಿಸ್ಕೊಟ್ರು. ಒಂದು ರೋಡ್ ಸೈನೇಜ್, ಗುಡ್ ಸೈನೇಜ್, ಒಂದು ಗುಡ್ ರೋಡ್ ಮಾರ್ಕಿಂಗ್ ಈ ತರದ ಅಂತ ಅಪಘಾತಗಳನ್ನ ಖಂಡಿತವಾಗಿ ತಪ್ಪಿಸುತ್ತೆ. ಇದನ್ನ ಮಾಡ್ತಕ್ಕಂಥವ್ರು ಪೊಲೀಸ್ನವರಲ್ಲ, ಅಲ್ಲಿರ್ತಕ್ಕಂತಹ ಪೌರ ಸಂಸ್ಥೆಗಳು, ಆ ಸಿವಿಕ್ ಕಮ್ಯುನಿಟೀಸ್ ಏನ್ ಕೊಡ್ಬೇಕು ಅವು ಆ ಕೆಲಸವನ್ನ ಮಾಡ್ತವೆ. ಉದಾಹರಣೆಗೆ BBMP ಬೆಂಗಳೂರಿನಲ್ಲಿ, ನ್ಯಾಷನಲ್ ಹೈವೇ ಅಥಾರಿಟಿ, PWD, ಇವ್ರಿಗೆ ಆ ಒಂದು ಜವಾಬ್ದಾರಿಯನ್ನ ಸರ್ಕಾರ ಕೊಟ್ಟಿದೆ. ಅವರು ನಾವು ನಮ್ಮ ಸಲಹೆಯನ್ನು ಪಡೆದು ನಿಮ್ಮಂತ ತಜ್ಞರ ಸಲಹೆಯನ್ನು ಪಡೆದು ಮಾಡ್ಬೇಕು. ಅದೇ ರೀತಿ ಒಳ್ಳೆಯ ಫುಟ್ಪಾತ್. ಯಾತಕ್ಕೆ ಮಾತನ್ನ ಹೇಳ್ತಾ ಇದ್ದೀನಿ ಅಂದ್ರೆ, ಬೆಂಗಳೂರಿನಲ್ಲಿ 2 ವೀಲರ್ಸ್ ನಂತರ ಹೆಚ್ಚು ಸಾವು ಸಂಭವಿಸ್ತಾ ಇರೋ 2 ವೀಲರ್ ರೈಡರ್ಸ್ ನಂತರ ಹೆಚ್ಚು ಸಾವು ಸಂಭವಿಸ್ತಾ ಇರ್ತಕ್ಕಂಥದ್ದು ಪಾದಚಾರಿಗಳು. 33% ಪಾದಚಾರಿಗಳು ಬೆಂಗಳೂರಿನಲ್ಲಿ ಸಾಯ್ತಾರೆ. ನಾನು ಆಶ್ಚರ್ಯ ಆಗ್ತದೆ, ಬೆಂಗಳೂರಿನಂತ ನಗರದಲ್ಲಿ ನೀವು 365 ದಿವಸವೂ ಕೂಡ ಮಳೆಗಾಲವನ್ನು ಮಳೆಯನ್ನು ಹೊರತುಪಡಿಸಿ ಚೆನ್ನಾಗಿ ನಡೆದುಕೊಂಡು ಸುಮಾರು 1.5 ಕಿಲೋಮೀಟರ್ ಹೋದ್ರು ದಣಿವಾಗಲ್ಲ. ಯಾವಾಗಲೂ ಇಲ್ಲಿಯ ವಾತಾವರಣದಲ್ಲಿ 34-35 ಡಿಗ್ರಿ ಸೆಲ್ಸಿಯಸ್ ಟೆಂಪರೇಚರ್ಗಿಂತ ಜಾಸ್ತಿ ಹೋಗಲ್ಲ, ಬಿಸಿಲು ಅಷ್ಟು ಪ್ರಖರವಾಗಿರಲ್ಲ. ಆದ್ರೆ ನಮ್ಮ ಫುಟ್ಪಾತ್ ಅದಕ್ಕೆ ಪೂರಕವಾಗಿಲ್ಲ. ಹೀಗಾಗಿ ಅವ್ರು ಏನ್ ಮಾಡ್ತಾರೆ, ರೋಡ್ ಸೈಡ್ ಅಲ್ಲಿ ನಡೆಯೋದಕ್ಕೆ ಪ್ರಾರಂಭ ಮಾಡ್ತಾರೆ, ಅಡ್ಡಾದಿಡ್ಡಿ ನಡೆಯೋದಕ್ಕೆ ಶುರು ಮಾಡ್ತಾರೆ. ಇವೆಲ್ಲವನ್ನ ಪರಿಗಣಿಸಿದಾಗ ಇದು ಕೂಡ ರೋಡ್ ಸೇಫ್ಟಿ ಫ್ಯಾಕ್ಟರ್ಗೆ ಒಂದು ಅಂಶ ಆಗ್ಬೇಕು. ನಾವೇನ್ ಮಾಡ್ತಾ ಇದೀವಿ, ಕಳೆದ 4 ದಶಕಗಳು ನಡೀತಾ ಇರ್ತಕ್ಕಂಥ ಸಂಶೋಧನೆ ಕೂಡ ಇಟ್ ಈಸ್ ವೆಹಿಕಲ್ ಡ್ರಿವನ್. ಯಾರು ವಾಹನಗಳನ್ನ ಇಟ್ಕೊಂಡಿದಾರೋ ಅವರನ್ನ ದೃಷ್ಟಿಲಿ ಇಟ್ಕೊಂಡು ಸಂಶೋಧನೆಗಳು ನಡೀತಾರೆ. ಮಡಿಬಾರ್ದು ಅಂತ ನಾನು ಹೇಳ್ತೇನೆ, ನಡೀಲಿ ಆ ತರ ಸಂಶೋಧನೆಗಳು. ಬಹಳ ಅಪಘಾತಗಳನ್ನ, ತೀವ್ರತರವಾದ ಗಾಯಗಳನ್ನ, ಸಾವುಗಳನ್ನ ತಪ್ಪಿಸುತ್ತೆ. ಆದ್ರೆ ಯಾರು ಕಾಲ್ನಡಿಗೆಯಲ್ಲಿ ಹೋಗ್ತಾರೋ ಅವರಿಂದ ನೋಡಿ ಪರಿಸರಕ್ಕೆ ಏನೋ ಹಾನಿ ಇಲ್ಲ. ಅವ್ರು ಯಾವ್ದು ಫ್ಯೂಲ್ ಖರ್ಚು ಮಾಡಲ್ಲ, ಅವ್ರು ಯಾರಿಗೂ ಕೂಡ ಹೊರೆ ಆಗಲ್ಲ, ಸರ್ಕಾರಕ್ಕೂ ಕೂಡ ಹೊರೆ ಇಲ್ಲ. ಇದು ಈಗ ನಮ್ಮ ಸಂಶೋಧನೆಯ ಒಂದು ಪರಿಕಲ್ಪನೆಯಲ್ಲೂ ಕೂಡ ಬದಲಾವಣೆಗಳಾಗಬೇಕು ಅಂತ ನನ್ನ ನಿರೀಕ್ಷೆಗಳು. ಯಾಕಂದ್ರೆ ಇಸ್ ಆಲ್ ನಾವು ಕೂಡ ನೋಡ್ತಾ ಇರ್ತೀವಿ. ಪ್ರತಿಯೊಂದು ಜಂಕ್ಷನ್ ನಲ್ಲಿ ನೀವು ಬೆಂಗಳೂರಿನ ಜಂಕ್ಷನ್ಗಳನ್ನ ಪರಿಶೀಲನೆ ಮಾಡಿ. ಬ್ಲೂಮ್ಬರ್ಗ್ನವರು ನಮ್ಮ ಜೊತೆ ಕೆಲಸ ಮಾಡ್ತಾ ಇದ್ದಾರೆ. ಬೆಂಗಳೂರಿನಲ್ಲಿ ಸುರಕ್ಷಿತವಾಗಿ ಪಾದಚಾರಿಗಳು ದಾಟತಕ್ಕಂತಹ ಜಂಕ್ಷನ್ಗಳು ಎಷ್ಟಿದ್ದಾವೆ? ಯು ಟೇಕ್ ನಮ್ಮ ಕ್ಲಾಸಿಕ್ ಎಕ್ಸಾಂಪಲ್ ಆಫ್ ಚಾಲುಕ್ಯ ಬಸವೇಶ್ವರ ಜಂಕ್ಷನ್. ಅಲ್ಲಿಯೇ ಒಂದು ಸಮೀಪದಲ್ಲಿ ಒಂದು ಕಾಲೇಜ್ ಇದೆ. ಅಲ್ಲೇ ಹುಡುಗರು, ಹುಡುಗಿಯರು, ಯುವಕರು, ಯುವತಿಯರು, ಅಲ್ಲಿ ಹೋಗ್ತಕ್ಕಂಥ ಮೇಷ್ಟ್ರುಗಳು ಎಲ್ಲರೂ ಕೂಡ ರಸ್ತೆಯನ್ನು ಉಪಯೋಗಿಸ್ತಾರೆ, ಬೇರೆಯವರು ಸಾರ್ವಜನಿಕರು ಉಪಯೋಗಿಸ್ತಾರೆ. ಅಲ್ಲಿ ಮಾಡಿರ್ತಕ್ಕಂಥ ರೋಡ್ ಡಿಸೈನ್ ಏನಿದೆ, ಇಟ್ ಇಸ್ ನಾಟ್ ಪೆಡೆಸ್ಟ್ರಿಯನ್ ಫ್ರೆಂಡ್ಲಿ. ಈಗ ನಾವೇನ್ ಮಾಡ್ತಾ ಇದೀವಿ, 30 ಸೆಕೆಂಡ್ಗಳು ಬರೋಬ್ಬರಿ ಎಲ್ಲ ಟ್ರಾಫಿಕ್ ನ ಸ್ಟಾಪ್ ಮಾಡಿ ಎಲ್ಲರನ್ನು ಬಿಡ್ತಾ ಇದ್ದೀವಿ. ಈ ತರದ ಸಮಸ್ಯೆಗಳು ಬಹಳ ಮುಖ್ಯವಾದ ಜಂಕ್ಷನ್ಗಳಿದ್ದಾವೆ. ವಿನ್ಸರ್ ಮ್ಯಾನರ್ ಜಂಕ್ಷನ್ ಸಮಸ್ಯೆ ಇದೆ. ಇದು KR ಸರ್ಕಲ್ ಕೂಡ ಈ ಸಮಸ್ಯೆ ಇದೆ. ಯಾತಕ್ಕೆ ಮಾತನ್ನ ಹೇಳ್ತಾ ಇದ್ದೀನಿ ಅಂತ ಹೇಳಿದ್ರೆ, ನಾವು ಕೇವಲ ವಾಹನ ಸವಾರರನ್ನ ದೃಷ್ಟಿಯಲ್ಲಿ ಇಟ್ಕೊಂಡು ನಮ್ಮ ಸಂಶೋಧನೆಗಳು ನಡೀತಾ ಇದ್ದಾವೆ. ಮತ್ತೆ ಆ ದೃಷ್ಟಿಯಲ್ಲಿ ನಮ್ಮ ರೆಕಮೆಂಡೇಶನ್ಸ್ ಕೂಡ ಹೋಗ್ತವೆ. ಇವತ್ತು ನಿಮಾನ್ಸ್ನಂತ ಸಂಸ್ಥೆ ಬಹಳ ಗಟ್ಟಿಯಾಗಿ ನಿಂದೆ ಹೋಗಿದ್ರೆ ಹೆಲ್ಮೆಟ್ ಕಡ್ಡಾಯ ಆಗ್ತಾನೆ ಇರಲಿಲ್ಲ. ಅದೇ ರೀತಿ ನಾನು ಏನ್ ನಿರೀಕ್ಷೆ ಮಾಡ್ತೀನಿ ಅಂತ ಹೇಳಿದ್ರೆ, ನಿಮ್ಮಂತ ತಜ್ಞರು ಯಾರಿದ್ದೀರಿ, ನೀವು ಹೇಳಿದಾಗ ಅದಕ್ಕೊಂದು ಗಾಂಭೀರ್ಯ ಬರ್ತದೆ. ಒಂದು ಜನ ಅದನ್ನ ಹೌದು ಸಂಶೋಧನೆ ಆಧಾರದ ಮೇಲೆ ಹೇಳ್ತಾ ಇದ್ದಾರೆ ಅಂತೀನಿ. ಉದಾಹರಣೆಗೆ ನಿಮಗೆ ಒಂದು ಬಹಳ 5 ನಿಮಿಷ ಜಾಸ್ತಿ. ಉದಾಹರಣೆಗೆ ಯಾತಕ್ಕೆ ನಿಮ್ಮ ಮಾತಿಗೆ ಬೆಲೆ ಇದೆ ಅಂತ ನಾನು ಹೇಳ್ತೀನಿ ಅಂತ ಹೇಳಿದ್ರೆ, ನಾವು ಫುಲ್ ಹೆಲ್ಮೆಟ್ ನ ಕಡ್ಡಾಯ ಮಾಡಬೇಕು ಅಂತ ಹೊರಟ್ವಿ, ಕ್ಯಾಂಪೇನ್ ಮಾಡಿದ್ವಿ. ಅಲ್ಲಿ ಕೆಲವರು ಬಂದು ಹೇಳಿದ್ರು, ಇಲ್ಲ ಪೊಲೀಸ್ನವರು ಕೆಲವು ಕಂಪನಿಯ ಹೆಲ್ಮೆಟ್ ಪ್ರಮೋಟ್ ಮಾಡೋದಕ್ಕೆ ಇದನ್ನು ಮಾಡ್ತಾ ಇದ್ದಾರೆ ಅಂತ. ಅಂದ್ರೆ ಆಶ್ಚರ್ಯ ಆಯ್ತು. ನಾನು ISI ಮಾರ್ಕ್ ಅಂತಕ್ಕಂಥ ಒಂದು ಕಂಪನಿ ಅಲ್ಲ. ಪೊಲೀಸ್ ಅಥವಾ ಒಂದು ಪೌರ ಸಂಸ್ಥೆ ಅಂತ ಮಾತನ್ನ ಹೇಳಿದಾಗ, ಅಥವಾ ಏನು ಟ್ರಾನ್ಸ್ಪೋರ್ಟ್ ಡಿಪಾರ್ಟ್ಮೆಂಟ್ ಅಂತ ಮಾತನ್ನ ಹೇಳಿದಾಗ, ಸರ್ಕಾರಿ ಅಧಿಕಾರಿಗಳು ಯಾಕೆ ಮಾತನ್ನ ಹೇಳ್ತಾ ಇದ್ದಾರೆ ಅನ್ನುವ ಒಂದು ಮಾತು ಬರ್ತದೆ. ಆದ್ರೆ ಒಂದು ತಜ್ಞರ ಸಂಸ್ಥೆ, ಒಂದು ತಜ್ಞ ಸಂಸ್ಥೆ, ನಿಮಾನ್ಸ್ನಂತ ಸಂಸ್ಥೆ ಹೇಳಿದಾಗ ಅದಕ್ಕೆ ಹೆಚ್ಚು ಮೌಲ್ಯ ಬರ್ತದೆ, ಬೆಲೆ ಬರ್ತದೆ. ಈ ಹಿನ್ನೆಲೆ ಒಳಗಡೆ ನಾನು ನಿಮ್ಮಲ್ಲಿ ಒಂದು ಕಲ್ಕಲಿಯ ಮನವಿಯನ್ನು ಮಾಡ್ತೇನೆ. ಪಾದಚಾರಿಗಳನ್ನು ದೃಷ್ಟಿಯಲ್ಲಿ ಇಟ್ಕೊಂಡು, ರೋಡ್ ಇನ್ಫ್ರಾಸ್ಟ್ರಕ್ಚರ್ ನ ದೃಷ್ಟಿಯಲ್ಲಿ ಇಟ್ಕೊಂಡು ಈ ಒಂದು ಸಂಶೋಧನೆಯನ್ನು ಮುಂದುವರಿಸಿದ್ರೆ ಇನ್ನೂ ನಾವು ಸಾವು ನೋವುಗಳನ್ನ ಕಡಿಮೆ ಮಾಡಬಹುದು. ಎರಡನೇದು, ನಾವು ಬಹಳ ಆಶ್ಚರ್ಯ ಆಗ್ತದೆ, ನಾವೆಲ್ಲ ಅನ್ಕೊಂಡ್ವಿ ಈ ಕಾಂಕ್ರೀಟ್ ರೋಡ್ ಮಾಡಿದ ನಂತರ ರಸ್ತೆ ಸುರಕ್ಷತೆ ಸ್ವಲ್ಪ ಹೆಚ್ಚಾಗಬಹುದು, ಯಾಕಂದ್ರೆ ಹಳ್ಳ ತಗ್ಗು ಎಲ್ಲ ಕಡಿಮೆ ಆಗ್ಬೋದು ಅಂತ ಹೇಳಿ. ಆದ್ರೆ ಹೈ ಇಂಟೆನ್ಸಿಟಿ ಆಕ್ಸಿಡೆಂಟ್ಸ್ ಜಾಸ್ತಿ ಆಗ್ತಾ ಇದೆ ಈ ರಸ್ತೆಗಳ ಮೇಲೆ. ಒಂದು ಬಹಳ ನೀಟಾಗಿರ್ತವೆ, ಸ್ಪೀಡ್ ಅನ್ನು ಕೂಡ ನಾವು ಮಾಡ್ತಾರೆ, ಬಟ್ ಆದ್ರೆ ಈ ರಸ್ತೆಗಳ ಮೇಲೆ ರೋಡ್ ಮಾರ್ಕಿಂಗ್ ಅನ್ನ ಮಾಡೋದು ಕಷ್ಟ. IRC ಇಂಡಿಯನ್ ರೋಡ್ ಕಾಂಗ್ರೆಸ್ ಅಂತ ಸಂಸ್ಥೆ ಇಲ್ಲಿ ಯಾವ ರೀತಿ ಇರ್ಬೇಕು, ಯಾಕಂದ್ರೆ ನೀವು ಬ್ಲಾಕ್ ಟಾಪ್ ರೋಡ್ ಮೇಲೆ ಮಾಡ್ತಕ್ಕಂಥ ರೋಡ್ ಮಾರ್ಕಿಂಗು ಗ್ರೇ ಟಾಪ್ ಇರ್ತಕ್ಕಂಥ ರಸ್ತೆ ಮೇಲೆ ಮಾಡ್ತಕ್ಕಂಥ ಇದು ಬಹಳ ಡಿಫ್ರೆಂಟ್ ಆಗಿರ್ಬೇಕು. ಅದು ಇವತ್ತಿನವರೆಗೂ ಕೂಡ ಯಾವ ರೋಡ್ ಮಾರ್ಕಿಂಗ್ ಅನ್ನ ಮಾಡ್ಬೇಕು ಅನ್ನೋದ್ರ ಬಗ್ಗೆ ಅವರು ನಿರ್ಧಾರನೆ ಮಾಡಿಲ್ಲ. ಇದು ಕೂಡ ಅಪಘಾತಗಳಿಗೆ ಮತ್ತು ಸಾವಿಗೆ ಕಾರಣ ಆಗ್ತಾ ಇದೆ. ನಾನು ನಿಮಾನ್ಸ್ಗೆ ಅದೆಲ್ಲ ಜವಾಬ್ದಾರಿ ವಹಿಸ್ಕೊಳ್ಬೇಕು ಅಂತ ಹೇಳ್ತಾ ಇಲ್ಲ, ಆದ್ರೆ ನಿಮ್ಮಿಂದ ಯಾವಾಗ ಒಂದು ಆಕ್ಸಿಡೆಂಟ್ ರಿಪೋರ್ಟ್ ಜನರೇಟ್ ಆಗುತ್ತೋ ನಾವು ಕೂಡ ಅದನ್ನ ಹೇಳ್ತೀವಿ. ನಾವು ಕೂಡ BBMP ಅವ್ರ ಜೊತೆ ಮಾತನಾಡಿದ್ವಿ. ನೀವು ಮಾಡಿರ್ತಕ್ಕಂಥ ರೋಡ್ ಮಾರ್ಕಿಂಗ್ ಕಾಣಿಸೋದಿಲ್ಲ. ಇವತ್ತು ಬೆಳಿಗ್ಗೆ ಕೂಡ ಇದು ಚರ್ಚೆ ಆಯ್ತು. ಇಂಡಿಯನ್ ರೋಡ್ ಕಾಂಗ್ರೆಸ್ ನೀಡಿರ್ತಕ್ಕಂತಹ ರೋಡ್ ಮಾರ್ಕಿಂಗ್ ಅನ್ನ ನಾವು ಗ್ರೇ ಟಾಪಿಂಗ್ ರೋಡ್ ಮೇಲೆ ಮಾಡಿದ್ರೆ ಕಾಣಿಸಲ್ಲ. ಅದನ್ನ ಬದಲಾವಣೆ ಮಾಡ್ತಕ್ಕಂಥವ್ರು ಯಾರು, ಒಂದು ಸ್ಟೇಕ್ ಹೋಲ್ಡರ್ಸ್ IRC ಅವರು ಮಾಡ್ಬೇಕು. ಅದನ್ನ ಕನ್ಸಲ್ಟೆಂಟ್ಸ್ ಅವರು ರೆಕಮೆಂಡ್ ಮಾಡ್ಬೇಕು. ಈ ಹಿನ್ನೆಲೆ ಒಳಗಡೆ ನಾನು ನಮ್ಮ ಸಂಶೋಧನೆಯ ವಿಸ್ತಾರ ಜಾಸ್ತಿ ಆಗ್ಬೇಕು ಅಂತೇಳಿ ನನ್ನ ನಿರೀಕ್ಷೆ. ಇದ್ರ ಜೊತೆಗೆ ನಾನು ಈಗಾಗಲೇ ಹೇಳಿದೆ, ಸೇಫ್ಟಿ ಗ್ಯಾಡ್ಜೆಟ್ಸ್, ಹೆಲ್ಮೆಟ್ ಇರ್ಬೋದು, ಸೀಟ್ ಬೆಲ್ಟ್ ಇರ್ಬೋದು, ಅಥವಾ ಬಹಳ ಸುರಕ್ಷಿತವಾದ ಚಾಲನೆ ಡ್ರೈವ್ ಮಾಡುವ ಸಂದರ್ಭದಲ್ಲಿ ಮೊಬೈಲ್ ಯೂಸ್ ಮಾಡ್ತಕ್ಕಂಥದ್ದು ಇರ್ಬೋದು, ಅಥವಾ ಮುಂದ್ಗಡೆ ಮಕ್ಕಳನ್ನು ಕೂರಿಸ್ಕೊಂಡು ಅವ್ರ ಜೊತೆ ಚಿಕ್ ಚಾಟ್ ಮಾಡಿ ಹೋಗ್ತಕ್ಕಂಥದ್ದು ಇರ್ಬೋದು. ಈ ತರದ ಅನೇಕ ಹ್ಯೂಮನ್ ಬಿಹೇವಿಯರ್, ಮನುಷ್ಯ ಸ್ವಭಾವಗಳೇನಿದೆ, ಇದರ ಬಗ್ಗೆಯೂ ಕೂಡ ನಮ್ಮ ಜನಕ್ಕೆ ತಿಳುವಳಿಕೆಯನ್ನು ನೀಡಿದಂತ ಪಕ್ಷದಲ್ಲಿ ಖಂಡಿತವಾಗಿಯೂ ಇದರಲ್ಲಿ ಬದಲಾವಣೆ ಆಗ್ತದೆ. ಇದಕ್ಕೆ ನಾವು ಬೆಂಗಳೂರು ಟ್ರಾಫಿಕ್ ಪೊಲೀಸ್ ಏನ್ ಮಾಡ್ತಾ ಇದ್ದೇವೆ, ಅವರ ಮಕ್ಕಳನ್ನೇ ಅವ್ರಿಗೆ ಬೋಧಕರನ್ನಾಗಿ ಮಾಡ್ತಕ್ಕಂಥ, ಟೀಚರ್ಸ್ ಆಗಿ ಮಾಡ್ತಕ್ಕಂಥ ಕೆಲಸವನ್ನ ಮಾಡ್ತಾ ಇದ್ದೇವೆ. ನಮ್ಮ ಸಾರ್ಸ್ ಪ್ರೋಗ್ರಾಮ್, ಸ್ಟೂಡೆಂಟ್ ಅಸೋಸಿಯೇಷನ್ ಫಾರ್ ರೋಡ್ ಸೇಫ್ಟಿ, ಆ ಕಾರ್ಯಕ್ರಮದ ಮೂಲಕ ಆ ಪ್ರಯತ್ನವನ್ನು ನಾವು ಮಾಡ್ತಾ ಇದ್ದೇವೆ. ಪೋಸ್ಟ್ ಕೋವಿಡ್ ಸಿಚುವೇಶನ್, ಕೋವಿಡ್ ಅವ್ರು ಹೇಳಿದ್ರು, ಕೋವಿಡ್ ನಿಮ್ಗೆಲ್ಲ ಗೊತ್ತಿದೆ, 2019 ಅಪಘಾತಗಳ ಸಂಖ್ಯೆ ಜಾಸ್ತಿ ಆಯ್ತು. 2020-21 ಕೋವಿಡ್ ಸಂದರ್ಭದಲ್ಲಿ ಅಪಘಾತಗಳ ಸಂಖ್ಯೆ ಕಡಿಮೆ ಆಯಿತು. ಆದ್ರೆ ಕೋವಿಡ್ ನಂತರ ಅಪಘಾತಗಳ ಸಂಖ್ಯೆಗಿಂತ ಅಪಘಾತಗಳ ತೀವ್ರತೆ ಜಾಸ್ತಿ ಆಗಿದೆ. ಒಂದೇ ಒಂದು ಅಪಘಾತದಲ್ಲಿ 3 ಜನ ಸಾಯ್ತಕ್ಕಂಥದ್ದು, ಒಂದು ಅಪಘಾತದಲ್ಲಿ 7 ಜನ ಸಾಯ್ತಕ್ಕಂಥದ್ದು, ಇದು ಆಗ್ತಾ ಇದೆ. ಮೂರನೇದು ನಾನು ಬಹಳ ಒಂದು ಗಂಭೀರವಾದ ಇದು ಚರ್ಚೆ ಮಾಡ್ಬೇಕಾದ ವಿಷಯ. ನಾನು ಇಟ್ ಇಸ್ ನಾಟ್ ಮೈ ಕನ್ಕ್ಲೂಷನ್. ಯಾವುದೇ ಒಂದು ಇದನ್ನ ನಾನು ಅನೇಕ ಸಂದರ್ಭಗಳಲ್ಲಿ ಹೇಳಿದ್ದೇನೆ. ಒಂದು ಜರ್ಮನಿ ಮೇಕ್ ವಾಹನ ಅಥವಾ ಯಾವುದೇ ವಿದೇಶಿ ನಿರ್ಮಾಣ ಮಾಡ್ತಕ್ಕಂಥ, ವಿದೇಶಿ ಕಂಪನಿ ನಿರ್ಮಾಣ ಮಾಡ್ತಕ್ಕಂಥ ವಾಹನ ಭಾರತಕ್ಕೆ ಬಂದಾಗ ವಿದೇಶದಲ್ಲಿ ಏನು ಸೇಫ್ಟಿ ಮೆಜರ್ಸ್ ಅದರೊಳಗಡೆ ಬಿಲ್ಟ್ ಆಗಿರುತ್ತೋ ಅದೇ ಪ್ರಮಾಣದಲ್ಲಿ, ಅದೇ ಗುಣಮಟ್ಟದಲ್ಲಿ ಬಿಲ್ಟ್ ಆಗಿದೆ ಅನ್ನೋ ಒಂದು ಪ್ರಶ್ನೆ ಇದೆ ನಮಗೆ. ಅದನ್ನ ಬೇರೆ ಬೇರೆ ಸಂಶೋಧನಾ ಸಂಸ್ಥೆಗಳು ತೆಗೆದುಕೊಳ್ಬೇಕು. ಯಾಕೆ ಮಾತನ್ನ ಹೇಳ್ತೀನಿ ಅಂದ್ರೆ, ಒಂದು ಅಪಘಾತದಲ್ಲಿ 7 ಜನ ಸಾಯ್ತಾರೆ ಅವರಲ್ಲಿ. ಅದು ಯಾವ ಕಂಪನಿ ನಾನು ಹೇಳಲ್ಲ, ಅದು ಒಂದು ಅಂತಾರಾಷ್ಟ್ರೀಯ ಕಂಪನಿ ನಿರ್ಮಾಣ ಮಾಡಿರ್ತಕ್ಕಂಥ ಕಾರು. ಒಂದೇ ಒಂದು ನಿಮ್ಮ ಏರ್ ಬಲೂನ್ ಓಪನ್ ಆಗಲ್ಲ ಅದ್ರಲ್ಲಿ. ಅಷ್ಟು ದೊಡ್ಡ ಅಪಘಾತ. ಇವತ್ತಿನವರೆಗೆ ನಮ್ಮ ಇನ್ವೆಸ್ಟಿಗೇಷನ್ ಅಲ್ಲಿ ಯಾತಕ್ಕೆ ಅದು ಓಪನ್ ಆಗಿಲ್ಲ ಅನ್ನೋದಕ್ಕೆ ತಜ್ಞರಾಗ್ಲಿ ಬೇರೆ ಬೇರೆ ಇಲಾಖೆಗಳಾಗ್ಲಿ ಸರಿಯಾದ ಉತ್ತರವನ್ನು ಕೊಡೋದಕ್ಕೆ ಸಾಧ್ಯ ಆಗಿಲ್ಲ. ಇದನ್ನ ಯಾರು ಕೂಡ ನಾವು ರೋಡ್ ಸೇಫ್ಟಿ ಫ್ಯಾಕ್ಟರ್ ಅಂತ ಏನು ಆ ಒಂದು ರಿಸ್ಕ್ ಫ್ಯಾಕ್ಟರ್ ನಲ್ಲಿ ನಾವು ಚರ್ಚೆ ಮಾಡೋದಿಲ್ಲ. ಈ ರಿಸ್ಕ್ ಫ್ಯಾಕ್ಟರ್ ಅಲ್ಲಿ ನಾವು ಕೇವಲ ರೈಡರ್ ನ ದೃಷ್ಟಿಯಲ್ಲಿ ಇಟ್ಕೊಂಡು ಮಾತ್ರ ಮಾಡ್ತಾ ಇರ್ತೀವಿ. ಈ ಹಿನ್ನೆಲೆವರೆಗೂ ಕೂಡ ಇದು ಆಗ್ಬೇಕು. What I am requesting, you can understand Kannada? No. What I am telling is that some international companies, they are producing cars and giving it to Indian market. At the same time, what we are not verifying is that whether the same safety measures is built in those cars, in those automobiles. There is a question because we are having a classic example in Bengaluru in which seven people are killed, occupants are killed in one accident in which no air balloon is opened. We are investigating that case. Unfortunately, we are not able to trace what is the reason. Therefore, what I am requesting is such research should go into that also because we are telling that we are a developing country. Whether those developed countries are selling cars which are inferior in quality, safety-wise to us, there is a question. It may sound very awkward to some people, but this is the question what we should ask them. This is my request with Bloomberg and ಆದ್ದರಿಂದ ನಾನೇನು ಹೇಳ್ತಾ ಇದ್ದೀನಿ ಅಂದ್ರೆ ನಮ್ಮ ಸಂಶೋಧನೆಯ ಮಜಲುಗಳು ಆಯಾಮಗಳು ಬದಲಾವಣೆ ಆದ್ರೆ ನಾವ್ಯಾರು ಫೀಲ್ಡ್ ಅಲ್ಲಿ ಕೆಲಸ ಮಾಡ್ತೀವಿ ನಮ್ಮ ಅಧಿಕಾರಿಗಳು ನನಗಿಂತ ಚೆನ್ನಾಗಿ ಅವರು ಸಂಚಾರ ಸಮಸ್ಯೆಗಳನ್ನ ಈ ರಿಸ್ಕ್ ಫ್ಯಾಕ್ಟರ್ಸ್ ನ ತಿಳ್ಕೊಂಡಿದ್ದಾರೆ 20-25 ವರ್ಷ ಕೆಲಸ ಮಾಡಿದ್ದಾರೆ ಅವ್ರಿಗೆ ಒಂದು ಸಣ್ಣ ತಿರುವಿನ ಬದಲಾವಣೆ ಅಪಘಾತಗಳನ್ನು ತಪ್ಪಿಸ್ತದೆ ಅನ್ನೋದು ಗೊತ್ತಿರ್ತದ. ಈ ಹಿನ್ನೆಲೆ ಒಳಗಡೆ ಈ ಚರ್ಚೆ ಮುಂದುವರಿಲಿ, ವಿಸ್ತಾರ ಆಗಲಿ. ನಾನಂತೂ ನಿಮಾನ್ಸ್ಗೆ ಬಹಳ ಕೃತಜ್ಞನಾಗಿದ್ದೀನಿ. ಐ ಆಮ್ ವೆರಿ ಗ್ರೇಟ್ಫುಲ್ ಟು ನಿಮಾನ್ಸ್ ಅಂಡ್ ಸ್ಟಾಫ್ ರಿಸರ್ಚರ್ಸ್ because you are doing a wonderful job. You are showing such a social responsibility towards the road users, commuters. BTP is very happy to associate with you. Thank you.
ಧನ್ಯವಾದಗಳು ಸರ್. ಈ ರಸ್ತೆ ಸುರಕ್ಷತೆ ಬಗ್ಗೆ ಬಹಳ ಸೂಕ್ಷ್ಮಾತಿ ಸೂಕ್ಷ್ಮ ವಿಷಯಗಳನ್ನ ಜೊತೆಗೆ ನಾವು ಮಾತಾಡ್ತಿರ್ತೀವಿ ನಮ್ಮ ವಿದ್ಯಾರ್ಥಿಗಳಿಗೆ ಈ ರಿಸರ್ಚ್ ಕ್ವಶನ್ ಹುಡುಕೋದು ಹೇಗೆ ಅಂತ. ಸೊ ಸಂಶೋಧನಾತ್ಮಕ ಪ್ರಶ್ನೆಗಳ ಹಲವಾರು ನೀವು ಇಲ್ಲಿ ತೆರೆದಿಟ್ಟಿದ್ದೀರಿ, ವಿಚ್ ಇಸ್ ಎ ವೆರಿ ಗುಡ್ ಓಪನಿಂಗ್ ಫಾರ್ ದಿಸ್ ಹಾಲ್ ಕನ್ಸಲ್ಟೇಷನ್. ಥ್ಯಾಂಕ್ ಯು ವೆರಿ ಮಚ್. ಅಂಡ್ ನಿಮ್ಮಾನ್ಸ್ನ ಸೇವೆಯನ್ನು ಕಳಕಳಿಯನ್ನು ತಾವು ಗುರುತಿಸಿದ್ದೀರಿ. ಧನ್ಯವಾದಗಳು ಸರ್. ಸೊ ವಿ ಮೂವ್ ಆನ್ ಟು ದ ನೆಕ್ಸ್ಟ್ ರಿಮಾರ್ಕ್ಸ್. ಶ್ರೀ ಜೆ ಜ್ಞಾನೇಂದ್ರ ಕುಮಾರ್ ಅವರು, ಅಡಿಷನಲ್ ಕಮಿಷನರ್ ಅಂಡ್ ಮೆಂಬರ್ ಸೆಕ್ರೆಟರಿ, Karnataka State Road Safety Authority. Sir.
Good afternoon. I'm Dr. Sativa Murthy, Director of Science. So the Dr. B.R. Ravikantegowda, Joint Commissioner of Traffic, Dr. Gururaj, Former Director, and presently the advisor to BCARIS, and Dr. Pradeep, Professor and the Head of Epidemiology, Dr. Gautam, and all the partners of Bloomberg Initiative, and all the traffic police personnel, and all the participants here. So this Karnataka State Road Safety Authority is one of the lead agency, which was formed in the year. I'll just start with the brief introduction of how this authority was started. In the year 2014, Supreme Court Committee on Road Safety issued a direction to form a authority. Initially, it was formed in the name of Road Safety Cell, as per the direction of the Supreme Court Committee, and then it was accorded a status of Road Safety Authority in the year 2018. This Road Safety Authority, the primary function of this is managing all the stakeholder departments. Police department is one of the major stakeholding departments, like transport, PWD, and then in the Bangalore it is a BBMP, and also a health department, and urban development department, and education department. With the coordination of what we are actually doing is we are doing the vertical coordination with the Ministry of Road Transport and Highways and with the Supreme Court Committee on Road Safety, and we are doing a horizontal coordination with all the stakeholding departments. Our primary concern is the prevention of the accident. That is, the objective is to reduce the fatality. Major objective is the reducing the fatalities. For that, we are working towards different methods and measures. As the road safety definition itself says, the methods and measures used for the road user for being killed in the road accidents. So Dr. Gururaj was telling in one of the discussion about don't call it as an accident, it's a crash. It's true also, because accident happens. Crashes is, no, it is even if we know that the things that is going to happen, we call it as a crash accident. Though they know the things, they're doing such kind of mistakes. So that's why we call this the particular, instead of calling it as a road accident, we call it as a road crashes. This road safety authority, this particular subject is multi-pronged strategy, like 4 E's. It contains education, engineering part 2. One is road engineering and vehicle engineering, and also the emergency care and education. There are 4 E's which plays a major role, which are all maintained by the stakeholding departments. With regard to the accidents, what we have to understand is the first one is the research-oriented analysis, and another is the pragmatic situation. Whatever police personnel and also the transport department, those enforcing agencies, how they are doing it. It's a real pragmatic situation. So the combined effort of both research studies and pragmatic situations, which is actually on the road, it will makes the road safety, it will be more energetic and fruitful also. In this regard, this authority, actually we formed a special committee with the Bloomberg Initiative. We have made a participatory agreement with Bloomberg Initiative, and our principal secretary is the chairperson of this, and myself is the member secretary for this authority, which involves all the stakeholding department. In fact, sir was telling about they call it inviting all the stakeholding departments in Bangalore, particularly DBMP. They are the major stakeholders. Police and the DBMP are the major stakeholders for the Bangalore city, because they are their work is very huge, and enormous work has to be done for the Bangalore city, particularly for the development of Bangalore city with regard to ease of the traffic, with regard to reduction in accidents. Now, with the help of Bloomberg initiatives, we have already taken up the development of 4 or 5 junctions. One is GKVK junction, another is Valekundri junctions is already developed. I think they have given a recommendation both to the traffic department and also the BBMP, and also the development of GKVK junction. The main purpose is, one is ease of traffic, decongesting the city, and other is reducing the accidents. And as for the directions of our respected chief secretary, they are yet to take up the 4 major junctions like Gorvintepalya, and then Silpur junction, and Karpuram junction, and Hebbal junction. I think very recently, I think some senior officers have visited that particular spots, like the Hebbal and the Gorvintepalya junction. I think the Bloomberg is also, with the support of a World Resource Institute, I think some of them are present here. They are taking up the development of the junction. So with the different in a different perspective. So almost around 70-75% of the GKVK junction is already developed. I think we are going to very soon. We are going to submit before the authority meeting, because this authority is headed by our chief secretary. They are the chairperson of this particular authority. And here we are taking up different initiatives. One is the Bloomberg initiative, and we have given the major road like from Nelmangala to Hiriyur, around 150 kilometer stretch to International Road Federation to study for the causes and the effects, and what is the prevention, what we call it as a prevention for the accident, because that is the major, highest accident takes place between this stretch from Nelmangala to Hiriyur. That is why we have requested the International Road Federation to take up that particular work of road safety audit, road safety education part, what is the trauma, emergency care part of it. In the same way, very soon, I think with the support of Ministry of Road Transport and Highways, state support program for strengthening road safety is also in the association of Asian Development World Bank. We are very soon. We are going to start that particular work by providing all kind of themes like road engineering, like emergency care and vehicle engineering. All this will be. We are yet to start. Very soon, we are going to start. The moment we get a clearance from the Ministry of Road Transport, we are going to start that particular program also. With all these things, NIMANS is giving all kind of support with regard to the major accident factor like helmet, with regard to that excessive speed, overspeeding, rational negligence, and use of mobile while driving, and also there are innumerable number of factors, out of which probably they have taken into 3 or 4 parameters into account for doing all kind of research and studies. I think it will be in the further discussion, we are going to discuss so many issues with regard to all these factors. And I think in the end, we will clarify certain issues with regard to that. With these few words, I request the concerned authorities to further proceed in this regard. Thank you.
Thank you very much, sir, for appraising us about the Karnataka State Road Safety Authority, as well as the initiatives taken up by this authority with Bloomberg Initiative and John Hopkins as well. And thank you very much for these opening remarks, sir. And before we go ahead with the technical presentations, our director has some other commitments also, so she has requested herself to be excused, sir, with your permission. And before Madam will leave, we would request you to present a small memento to both our chairpersons, so that from Nimans, Sir Tamage, from Nimans.
Thank you very much. I'm just going to share the good news that we have retained the NIRF ratings at number 4. So, PGR, and CMC Vellore are ahead of us, but they're all medical colleges. We are the first institution of a specialized nature. Thank you very much.
Congratulations, madam. Thank you. Thank you so much. Yeah. So, ಮುಂದುವರಿಸ್ತಾ ಇಬ್ಬರು ಚೇರ್ಪರ್ಸನ್ಸ್ ಅನುಮತಿ ಜೊತೆಗೆ we'll have our first technical presentation for the day. It is from Dr. Nishit Patel, Research Associate, International Injury Research Unit, Johns Hopkins Bloomberg School of Public Health. Our road safety risk factor assessments in cities and overview in India. ಅಂದ್ರೆ ರಸ್ತೆ ಸುರಕ್ಷತೆಯ ಅಂಶಗಳ ಬಗ್ಗೆ ಅದರ ಅಸೆಸ್ಮೆಂಟ್ಸ್ ಏನಿದೆ ನಗರಗಳಲ್ಲಿ ಸರ್ ಪ್ಲೀಸ್ ಸರ್ ತಾವು ಆ ಕಡೆ ನಗರಗಳಲ್ಲಿ ರಸ್ತೆ ಸುರಕ್ಷತೆಯ ಪರೀಕ್ಷೆ ಅಥವಾ ಅದರ ಅಸೆಸ್ಮೆಂಟ್ ಹೇಗೆ ಅನ್ನೋದು ಭಾರತದಲ್ಲಿಯ ಒಂದು ಪಕ್ಷಿನೋಟವನ್ನು ಅವರು ಪ್ರಸ್ತುತಪಡಿಸ್ತಾರೆ. ಡಾಕ್ಟರ್ ನಿಶಿತ್ ಪಟೇಲ್, ಓವರ್ ಟು ಯು. ಅವರು ರಿಸರ್ಚ್ ಅಸೋಸಿಯೇಟ್ ಆಗಿ ಜಾನ್ ಹಾಪ್ಕಿನ್ಸ್ ಬ್ಲೂಮ್ಬರ್ಗ್ ಸ್ಕೂಲ್ ಆಫ್ ಪಬ್ಲಿಕ್ ಹೆಲ್ತ್ ನಲ್ಲಿ ಕೆಲಸ ಮಾಡ್ತಿದ್ದಾರೆ, ಇಂಜುರಿ ರಿಸರ್ಚ್ ಯೂನಿಟ್ ನಲ್ಲಿ. ನಿಶಿತ್, ಓವರ್ ಟು ಯು.
Hi everyone, and thank you very much, Dr. Pradeep, for allowing me to present today. And actually, it's an honor to be here, and it's really nice to see that the Karnataka government is taking a leadership role in addressing road safety in the state. So, in the interest of the time, I'll just start directly. So, before I start, I just want to thank a few people. Okay, so I would really like to thank the Bengaluru Traffic Police Department, the Joint Commissioner, Bengaluru Traffic Police, Additional Commissioner and Member Secretary KRSA, the Principal Secretary of the Transport Department, the Director and the entire NIMHANS team, which is also led by Dr. Gautam and Dr. Gururat, for organizing this event, and the PRS Water Strategies Embedded team in the BMR region for also helping us to join this event, and all the guests present today at large. I will briefly touch upon our establishment as JHU, which was established in 2008 as a way to respond to the growing burden of injuries. We strive to identify and implement effective solutions to the growing burden of injuries, especially in middle-income countries. We do this by influencing public policy and practice and advancing the field of injury prevention throughout the world. We're also a designated World Health Organizing Collaborating Center for Injury, Violence, and Accident Prevention. So we have a diverse portfolio of projects going on in 30 countries of the world, both previous and current projects. And so this covers the entire spectrum of injuries, from intentional and unintentional injuries, from acute care to trauma management and disabilities prevention. Some of the work we do involves foundational, developmental, intervention, and dissemination research. The strategy we use is a multi-pronged strategy that uses collaboration, research, and training to address all the types of injuries. So injury can be anything. It could be from road traffic injuries to drowning to adolescent injuries. We use a strong emphasis on systems-based strategies to develop innovative solutions for injuries, trauma, disabilities, providing effective interventions, implementation, monitoring and evaluation, and scalability of projects in the long term. So partnership with Big Areas began in the first phase, which was in 2010 to 2014. It started from 3 cities in India, that was Hyderabad, Jalandhar, and Visakhapatnam. And then in phase 2, between 2015 and 2019, it was Mumbai. And now in phase 3, we've expanded to 4 cities, Mumbai, Delhi, Bengaluru, and Pune has recently been added. And we're also involved in Maharashtra state level work, where we'll be doing a lot of observations on speeding. The scope of work involves 4 major activities: observational research study, through which we will collect a lot of city-specific data for helmet use, seatbelt, child restraint, and drunk driving and speeding. Well, drunk driving for this particular period was suspended due to the COVID pandemic. So we replaced that with nighttime speeding rounds. So we're collecting both daytime speeding and nighttime speeding. And there's another project that we are soon embarking on, is the compliance monitoring study for the recently enacted Motor Vehicle Act, Amendment Act of 2019. This will be a mixed method research, which will focus both on qualitative and quantitative research. And the main focus will be on the specific domains of speed within the MVA 2019 and see how well it's been implemented versus how well is the compliance with it. And we're probably thinking of starting with the 2 states, where we'll provide more information as it comes in. Karnataka is one of the states. We're still looking for another state. And then we also collaborate with partners, both the Big RS partners and the government partners. We provide data-related technical assistance to partners' initiatives, and we're also looking forward to focusing on coordinated outcomes with both the government agencies and both the Big RS partners as well. There's also another activity that we conduct is training, the data dissemination workshop going forward, that we'll be having 1 yearly data dissemination workshops in all the cities. And we have this Johns Hopkins course offerings. There are some webinars and some courses on the website. And there's this Global Road Safety Leadership course, which is administered together with the Global Road Safety Partnership. It's a 2-week intensive road safety course. And these are the links available for the training module link. So that's a Global Road Safety Leadership course. And below that is the Hopkins website link for the courses. So a basic overview of our involvement in the BMR region. We'll be conducting observational studies in collaboration with NIMHANS. So we have a robust standardized sampling protocol that is it's similar across 28 cities of the world, but it has a lot of contextual flexibility. So we make sure that we select locations that is representative of the BMR region. We conduct 1 baseline round of observational studies on 3 risk factors, which is speeding, helmet use, and seatbelt. That round is almost about to be over, and we'll have some results very soon. And in 2023, we'll conduct 2 observational rounds on speed. So we'll also conduct special studies which are required by the city government or partners, which comes in as a request. That will be contingent on budget and necessary approvals from the local government. We also support other citywide initiatives, especially the ongoing advocacy efforts for standardized strapped helmet in Bengaluru region. And we disseminate interim round technical reports and an annual general audience report with very high level findings and recommendations. So I will just skip this slide. I think Dr. Cotton will show the methodology. And So these are examples of the round reports from other Indian cities. We can see that for the first one is for Delhi. We just completed a baseline round and we generate a technical appendix. It's a contextual specific technical appendix for both Delhi and Mumbai. And very soon we'll generate one for Mumbai once the round is complete. We'll continually engage with your department to make sure that this report is well representative and the results are good enough. So from the biggest program, city level impacts, we can see that since 2014, we have had some wins together. So from Accra, we can see they reduced their road traffic deaths by 36% between 2014 and 2017. In Addis Ababa, reduced drink driving from 9.7 to 2.3% in 2018. And in Bangkok, they increased their helmet wearing from 56% in 2015 to 65% in 2018. Fortaleza reduced road traffic deaths by 40% between 2014 and 2018. While in Mumbai, they reduced their road traffic deaths by 22% between 2015 and 2018. Also in Shanghai, we saw a reduced road traffic deaths by 25% between 2014 and 2017. So finally, the proposed outcome and the impact we are trying to have in the PMR region is that trying to influence all the four main components of road safety as you actually described, and through data, we provide important insights on enforcement. For example, improving efficiency among available personnel and prioritizing enforcement based on observational data findings. Also for education, targeted mass media messages, improving awareness, education on road safety risk factors. And also for engineering, address the measures to address speed, like visible signage, rumble strips, and other speed calming measures. And finally, the emergency care, we're trying to see how we can have a better linkage of the risk factor data and the outcome, the surveillance level data that identifies high risk corridors and helps to improve emergency care in those areas. Yeah. That's it from my side, and thank you very much. And perhaps you can have some questions right now or towards the end.
One question.
Yeah.
What is the meaning of your restraining child? This thing was
Child restraint.
The child restraint is.
Do you want to take the project in Bengaluru?
So it's one of the road safety risk factors. It is not being studied yet.
Not studied.
Not yet studied, yeah.
But in Bengaluru, you have to study and give a result.
So we have
Very important.
Yes. So when we take seatbelt data, we take it for all the ages, but especially for passengers. It's actually been categorized by age groups, and then we also categorize the seatbelt. The child restraint by age as well. So age-appropriate child restraint use. So the baseline round that we've collected has seatbelt level data. So once these rounds are ready, data is analyzed, you'll have a very good disaggregated data.
Child car seats, not many, nobody was using that. Nobody was, because along with seat belts, we also looked at that, but didn't find it.
But it is not mandatory in our country. But there is a penal provision is already there. Penal provision is there. 193C, I think so. Section 193 of Amended Act.
Yeah.
It is there, but it is not made mandatory. Those were
Then
more than 14 years.
Then why penal section? If it is not mandatory.
It's a state subject. I think states have the liberty to implement it or not. Yeah.
Thank you, Dr. Nishit, and with your permission, I'll just briefly summarize what you presented in Kannada. ಈಗ ಡಾಕ್ಟರ್ ನಿಶತ್ ಪಟೇಲ್ ಅವರು ವಿವಿಧ ನಗರಗಳಲ್ಲಿ ಏನು ರಸ್ತೆ ಸುರಕ್ಷತೆ ಜಾಗತಿಕ ರಸ್ತೆ ಸುರಕ್ಷತಾ ಕಾರ್ಯಕ್ರಮದ ಮೂಲಕ ಸಂಶೋಧನೆಯ ವಿಷಯಗಳು ಅದರಿಂದ ಮೂಡಿಬಂದಂತಹ ಉತ್ತರಗಳನ್ನ ಅಳವಡಿಸಿದಾಗ ಯಾವ ರೀತಿ ರಸ್ತೆ ಸುರಕ್ಷತೆ ಮೇಲೆ ಪರಿಣಾಮ ಬೀರಿದೆ ಅನ್ನೋದನ್ನ ಎಲ್ರಿಗೂ ಪ್ರಸ್ತುತಪಡಿಸಿದ್ರು. ಮುಂದುವರಿತಾ ನಾವು we'll go ahead with the next technical presentation with permission of the chair, sir. And I request Dr. Gautam, who is our additional professor in the Department of Epidemiology, to present observational study of road safety risk factors in Bengaluru city. So Gautam ಅವರು ಈಗ ಇಲ್ಲಿ ಬೆಂಗಳೂರು ನಗರದಲ್ಲಿ ಈಗ ಏನು ಸಂಶೋಧನೆ ಮಾಡಿದ್ದಾರೆ, ಅತಿ ದೊಡ್ಡ ಒಂದು ಸಂಶೋಧನೆ, ಅದರ ಬಗ್ಗೆ ಮಾಹಿತಿಯನ್ನು ತಮ್ಮೆಲ್ಲರಿಗೂ ಪ್ರಸ್ತುತಪಡಿಸ್ತಾರೆ.
ಧನ್ಯವಾದಗಳು ಸರ್. ಎಲ್ಲರಿಗೂ ನಮಸ್ಕಾರ. At the outset, I would like to express our sincere thanks to the senior most officials from the Department of Transport as well as from the Bangalore Traffic Police for their continued support to demands to carry out activities related to reduction of road traffic crashes, fatalities, and the ensuing disabilities. We are also happy that we are a small part of this larger government-led initiative by the Transport Department, along with a host of other partners from Bloomberg Vital Strategies. So we are associated with Johns Hopkins to develop research evidence that can help the Transport Department and the Karnataka Road Safety Authority to bring about evidence-based changes. So with this, it should be very interesting. So Kannada English.
So it could use a mix because there are a lot of people joining from all other countries.
Okay. So with support from the Bangalore Traffic Police, the Transport Department, and Johns Hopkins University, one of the largest survey of risk factors or baseline assessment of risk factors, now Bengaluru, now Madidiri, Police Department Sayoga Jate. So the objective was to assess the baseline status of speeding, seatbelt and helmet use in Bengaluru city, Bengaluru Nagara, Matra, to conduct road safety sensitization program for stakeholders which focus on these three things: speeding, seatbelt, helmet. So now, ನಾನು ಹೇಳ್ದಂಗೆ ಬರೇ ಹೆಲ್ಮೆಟ್ ಸೀಟ್ ಬೆಲ್ಟ್ ಸ್ಪೀಡಿಂಗ್ ನಾವು ಬೆಂಗಳೂರು ನಗರ ವ್ಯಾಪ್ತಿಯಲ್ಲಿ ನಾವು ನೋಡಿದೀವಿ. ಸ್ಪೀಡಿಂಗ್ both daytime speeding and nighttime speeding, both we are assessed. So we have this entire process, we have to go through a lot of permissions and support. I'm very happy to say that this particular project, sir, is cleared by the Health Ministry Screening Committee from ICMR. It has got the ethics clearance both from Johns Hopkins as well as NIMANS, and it is a part of, as I told, it's a part of the larger government-led initiative with the Transport Department. And in fact, our Joint Commissioner of Police, Ravi Kantegowda sir, was very generous enough to recognize the importance of this survey, and he shot out letters to all the DCPs to ensure that they participate and provide necessary support. And with this background, we didn't just go and select some roads. ಸುಮ್ಮನೆ ಹೋಗಿ ಯಾವುದೋ ರಸ್ತೆ ಇಟ್ಕೊಂಡು ನಾವು ಸರ್ವೆ ಮಾಡಿಲ್ಲ ಇದು. ಯಾಕಂದ್ರೆ ನಾವು ಏನು ಫೈಂಡಿಂಗ್ಸ್ ಇದರಿಂದ ಬರುತ್ತೆ, ಇಡೀ ಬೆಂಗಳೂರು ನಗರಕ್ಕೆ ನಾವು ಜನರಲೈಸ್ ಮಾಡಬೇಕು, ಅಂದ್ರೆ ಅದಕ್ಕೂ ಕೂಡ ಅದು ಅಪ್ಲೈ ಆಗಬೇಕು. ಸೊ there are 8 zones in the BBMP zone, 8 BBMP zones. All the zones were included. We followed a multi-stage sampling method to identify the study units, that is the roads and the vehicles. So from the 8 BBMP zones, all the zones were included. How many wards to be selected from each zones was based on the population density. ಎಷ್ಟು population ಜಾಸ್ತಿ ಇದೆ ಅಷ್ಟು wards ಆ particular zone ಇಂದ ನಾವು ತಗೊಂತೀವಿ ಈ sampling ಗೆ. So global protocol is to select 15 locations. So we have to select 15 wards to conduct this survey. So 15 wards were randomly selected based on population density, and the number of wards to be selected from each BBMP zone was also based on population density. So within the ward, randomly using random GPS coordinates, we selected one point. The road nearest to the point was included for the survey, provided the road satisfies all the criteria that is set at the global level. So 15 roads were randomly selected. After random selection of the roads, simply we did not go to survey those roads. A specific checklist was made based on a global criteria to determine whether the road fulfills the criteria for this assessment. A team was made that went to the road and assessed the criteria, and if the road fulfilled the criteria, it was uploaded onto the Johns Hopkins to collect application. They also verified the credentials that were supplied by NIMANS, and then both were in sync that okay, this is the right place for doing the survey. That road was included for this particular assessment. So with this, even in the road, there was sampling with respect to which lane to select, the direction of movement of vehicles, as well as particular time of the day. So a total randomness was ensured in the entire process of sampling such that the role for bias would be as less as possible. So with this background, ಅಂದ್ರೆ ನಾನು ಏನು ಹೇಳಕ್ಕೆ ಇಚ್ಛೆ ಪಡ್ತೀನಿ ಅಂದ್ರೆ ಸುಮ್ಮನೆ ಸೆಲೆಕ್ಟ್ ಮಾಡಿಲ್ಲ ರೋಡ್ ತುಂಬಾ ವೈಜ್ಞಾನಿಕ ರೀತಿಯಲ್ಲಿ ರೋಡ್ ಮತ್ತು ವೆಹಿಕಲ್ ನ ಸೆಲೆಕ್ಟ್ ಮಾಡಿದೀವಿ. So finally, because of this, there were 4 wards that were selected from BBMP West, 3 wards from BBMP South, 2 wards from BBMP East, 2 from Dasralli, and 1 each from Bomnalli, Rajarajeshwari Nagar, Yelahanka, and Mahadevapura. Though they are bigger in size, they are lesser in population density. So I told all this now. I want to go directly to the results. So we have like the site selection survey ಮಾಡಿದ್ವಿ. ಸರ್ವೆ ಆದ್ಮೇಲೆ ನಾವು ರೋಡ್ ನ ಸೆಲೆಕ್ಟ್ ಮಾಡಿದ್ವಿ. ಸರ್ವೆಗೆ ಒಂದು ಕ್ರೈಟೀರಿಯಾ ಇತ್ತು, ಯಾವ ತರ ರೋಡ್ ಸೆಲೆಕ್ಟ್ ಮಾಡ್ಬೇಕು ಅಂತ. ನಮ್ಮ ಸ್ಟೂಡೆಂಟ್ಸ್ ನಾವು ಎಲ್ಲವೂ ಸೆಲೆಕ್ಟ್ ಮಾಡಿ ಆದ್ಮೇಲೆ ನಾವು finally this is the 15 sites that if you see they are quite well distributed in the BBMP limits. So there are areas that are covered in the core BBMP zones. There are areas that are covered in the outer zones of BBMP also, and it truly reflects the way the population is distributed as well. So before actually conducting the survey, the team, both at NIMAS, we underwent training with the team from Johns Hopkins University, exchanged the issues on both sides, and after clarification, we went ahead with data collection. Data collection ಹೆಂಗ್ ಮಾಡಿದ್ವಿ ಅಂದ್ರೆ ಒಂದೊಂದು ರೋಡ್ ಅಲ್ಲಿ ಯಾವುದು ಸೆಲೆಕ್ಟ್ ಆಗಿದೆ ರೋಡ್ ಅಲ್ಲಿ each site 3 days observation was conducted in each road. Out of that, 1 was a weekend. So 2 weekdays and 1 weekend in each of the road. In each day, there were 5 sessions. That was 5 observation sessions. Each observation session lasted for 90 minutes. Additionally, for speeding, we had 2 more sessions at night. That is, in the sense, the investigators would reach the site early morning by around 7 o'clock. The observations would start at 7:15. ಬೆಳಗ್ಗೆ 7 ಕಾಲಿಗೆ ಶುರು ಮಾಡ್ತಿದ್ರು. ಮೊದಲು 15 ನಿಮಿಷ ವೆಹಿಕಲ್ ಎಷ್ಟು ವೆಹಿಕಲ್ಸ್ ಹೋಗುತ್ತೆ ಅಂತ ಕೌಂಟ್ ಮಾಡ್ತಿದ್ರು, ವೆಹಿಕಲ್ ಕೌಂಟ್. ಅದಾದ್ಮೇಲೆ ಮಿಕ್ಕಿದ 90 ನಿಮಿಷ ಹೆಲ್ಮೆಟ್ ಬಳಿಕೆ, ಸೀಟ್ ಬೆಲ್ಟ್ ಬಳಿಕೆ ಅವರು ನಿಂತ್ಕೊಂಡು ಅಬ್ಸರ್ವ್ ಮಾಡಿ ಒಂದು ದಾಖಲೆಯನ್ನು ಮಾಡ್ತಿದ್ರು. So there was a 90 minutes of observation and 15 minutes of vehicle count. 5 sessions, the day sessions used to end at 7 o'clock. Subsequently, there were sessions from 7:45 to 12 noon, 12 a.m. at night for assessment of speeding.
This study is only for Bangalore BBMP area only, other than BBMP area. That is big RS initiative.
Yes, sir. The
Big
biggest
initiative is for BMRD area.
Yes, sir.
You have taken only the study in the BBMP
Yes,
area,
sir.
not out beyond that BBMP.
Sir, in the phase 1 is the BBMP area. In the phase 2, as I told, every Thursday we will be there. We have sampled the locations in the Bengaluru metropolitan region, which includes Bengaluru rural district and Ramnagar district. So that once we finalize the locations with the department of with the Karnataka Road Safety Authority as well as other partners, then we can initiate discussions to conduct the survey there.
To extend
the survey. Sir. So one observer, one recorder will be there. Data collection happens through using tablets. The collected data was reviewed. ಪ್ರತಿ ವಾರ ನಾವು ಅವ್ರು ಏನ್ ಡೇಟಾ ಕಲೆಕ್ಟ್ ಮಾಡ್ತಾರೋ ಅದನ್ನ ರಿವ್ಯೂ ಮಾಡ್ತಿದ್ವಿ. ಅದನ್ನ ಜಾನ್ ಹಾಪ್ಕಿನ್ಸ್ ಕಡೆದವರು ಕೂಡ ರಿವ್ಯೂ ಮಾಡ್ತಿದ್ರು. ಪ್ರತಿ ತಿಂಗಳು ಪೊಲೀಸ್ ಕಮಿಷನರ್ ಆಫೀಸ್ಗೆ, ಜಾಯಿಂಟ್ ಪೊಲೀಸ್ ಕಮಿಷನರ್ ಆಫೀಸ್ಗೆ ನಾವು ಒಂದು ಅಪ್ಡೇಟ್ ನೀಡ್ತಿದ್ವಿ. ಸೊ ಇದು ನಾವು ಯಾವ ತರ ಈ ಒಂದು ಸಂಶೋಧನೆಯನ್ನ ನಾವು ಹೆಂಗ್ ಮಾಡಿದ್ವಿ ಈ ಸರ್ವೆ ಅಂತ ಇದೊಂದು ಪುಟ್ಟ ನಾನು ಬ್ರೀಫ್ ಆಗಿ ಹೇಳಿದ್ದೀನಿ. ಸೊ ಇದ್ರ ಫೈಂಡಿಂಗ್ಸ್ ಇಂಪಾರ್ಟೆಂಟ್, ನೀವೆಲ್ಲರೂ ಇವತ್ತು ಇರೋದು ಇದಕ್ಕೋಸ್ಕರನೇ ಫೈಂಡಿಂಗ್ಸ್. ಏನ್ ಕಂಡಿದ್ವಿ ನಾವು, ವಾಟ್ ಡಿಡ್ ವಿ ಫೈಂಡ್ ಔಟ್? ವಿ ಅಬ್ಸರ್ವ್ಡ್ 98,021 2-wheelers for helmet use. 98,021 to nearly 100,000 2-wheelers were observed across 15 locations, 225 observation sessions, 20,250 minutes of observation. So it's one of the largest surveys of road safety risk factors actually conducted in Bangalore. Throughout, since the efforts of all the stakeholders is visible on the ground, in most of the main roads, we see that any helmet use is around 92%. So 10 ಜನ ಗಾಡಿ ಓಡಿಸ್ತಿದ್ರೆ 9 ಜನ ಯಾವ್ದಾದ್ರು ಒಂದ್ ರೀತಿ ಹೆಲ್ಮೆಟ್ ಹಾಕಿರ್ತಾರೆ. ಯಾವುದೋ ಒಂದ್ ರೀತಿ ನಿಮ್ ಬೈಕ್ಗೋಸ್ಕರ ಆದ್ರೂ ಒಂದ್ ಹೆಲ್ಮೆಟ್ ಹಾಕಿರ್ತಾರೆ. ಸೊ ನಮ್ ಸರ್ವೆ ಕೂಡ ಅದೇ ಕಂಡಿಡಿದಿದೆ, 92% ಇದೆ ಹೆಲ್ಮೆಟ್ ಯೂಸ್. ಬಟ್ ಯಾವ ತರ ಹೆಲ್ಮೆಟ್ ಹಾಕೊಂಡಿದ್ರೆ ಅಂತ ನಾವು ಬ್ರೇಕಪ್ ನೋಡಿದ್ರೆ, ಸ್ಟ್ಯಾಂಡರ್ಡ್ ಹೆಲ್ಮೆಟ್ ಯೂಸ್, ಪ್ರೊಪೋರ್ಷನ್ ಆಫ್ ಸ್ಟ್ಯಾಂಡರ್ಡ್ ಹೆಲ್ಮೆಟ್ ಯೂಸ್ ಅಂದ್ರೆ ಫುಲ್ ಫೇಸ್ ಹೆಲ್ಮೆಟ್ ವಿತ್ ಸ್ಟ್ರಾಪ್ ನೋಡಿದ್ರೆ 24% ಇಳಿಯುತ್ತೆ. ಸೊ 94% ಇಂದ ಸ್ಟ್ಯಾಂಡರ್ಡ್ ಹೆಲ್ಮೆಟ್ ಯೂಸ್ ನೋಡಿದಾಗ ನಾವು ಹೆಲ್ಮೆಟ್ ಬಳಕೆ, ಸರಿಯಾಗಿ ಹೆಲ್ಮೆಟ್ ಬಳಕೆ 24% ಬಂದು ನಿಂತ್ಕೊಳ್ಳುತ್ತೆ. ಕ್ಯಾಪ್ ಹೆಲ್ಮೆಟ್ ಬಳಕೆ ಆಲ್ಮೋಸ್ಟ್ ಕೇರಿಂಗ್ 27% ಇದೆ. ಸೊ ಹೆಲ್ಮೆಟ್ ಧರಿಸಿದ್ರೆ ನಾವೇನಕ್ಕೆ ಫಾರ್ ದಿ ಪ್ರೊಟೆಕ್ಷನ್ ಫಾರ್ ಸೇವಿಂಗ್ ದ ಲೈಫ್. ಕ್ಯಾಪ್ ಹೆಲ್ಮೆಟ್ is not good enough to save one's life. So that is also one of the important findings of this survey. 32 to 43% of the riders did not strap the helmets. 32 to 43% did not strap the helmets. If you go by age group, one important thing we observed was among the youth have got a different kind of behavior, sir. Youth only helmet use percent is lower. Cap helmet use is higher. And also the standard helmet use percentage is lower. So youth, they have a preference to wear a cap helmet. On the other hand, if you look at the female riders, if you look at the bars in the pink, the vertical bars in the pink, standard helmet use is less among female riders, but females get half helmet is preferred more. So preference is basically for half helmet. If you see, 45% of all the female riders are wearing half helmet. And the standard use is only around 14% among the female riders. If you look at the helmet use in different kinds of roads, that is in our highways and main roads and inner roads, we see that cap helmet use is less in the highways, probably because the people who are using highways perceive that they are at high speeds and likely cap helmet may not protect them. So cap helmet use kammi ide, but standard helmet use is better in highways. Even in the arterial roads, we see that the helmet use is little better. But we didn't find any differences between weekdays and weekends. More or less, it's the same way. All the bars are equal. If you see almost all the bars are equal here. Weekdays and weekend, it's the same. Now the interesting part is we have understood about how the helmet use is about riders. Now pillion bandaga scenario totally change ಆಗುತ್ತೆ. Scenario pillion helmet ಬಳಕೆ pillion ನಲ್ಲಿ ತುಂಬಾ ಕಮ್ಮಿ ಇದೆ. 74% any helmet use ಇದೆ compared to 92% among riders. The proportion of helmet users among pillion is very less. And we have observed that there is a preference for using cap helmet among pillion. That is 7 out of every 10 pillion riders are using cap helmet. So 67% is there, or 65% is there, cap helmet among users. And use rates is also lesser in highways. Maybe we don't know, we need to understand the reason why, whether enforcement is lesser in the highways. So the key findings of helmet observation is helmet use has improved significantly because of the efforts of all the stakeholders since 2008. And there is now with improved helmet use, ಯಾವುದೋ ಒಂಥರ ಹೆಲ್ಮೆಟ್ ಹಾಕ್ತಿದ್ದಾರೆ ಜನ, ಬಟ್ ಈಗ ನಾವು ದಿಸ್ ಇಸ್ ದ ಟೈಮ್ ಟು ಫೋಕಸ್, ಟು ಶಿಫ್ಟ್ ದ ಫೋಕಸ್ ಟು ಸ್ಟ್ಯಾಂಡರ್ಡ್ ಹೆಲ್ಮೆಟ್ ಯೂಸ್. ಬರೀ ಹೆಲ್ಮೆಟ್ ಹಾಕಿದ್ರೆ ಸಾಲಲ್ಲ, ಗುಣಮಟ್ಟವಾದ ಸ್ಟ್ಯಾಂಡರ್ಡ್ ಹೆಲ್ಮೆಟ್ ಬಳಕೆ ತುಂಬಾ ಇಂಪಾರ್ಟೆಂಟ್. ಆ ದೃಷ್ಟಿಯಲ್ಲಿ ನಮ್ಮ ಎಫರ್ಟ್ಸ್ ಈಗ ನಾವು ಫೋಕಸ್ ಮಾಡಬೇಕು. ಯೂಸ್ ರೇಟ್ಸ್ ಇಸ್ ಬೆಟರ್ ಇನ್ ದ ಮೇನ್ ರೋಡ್ಸ್, ಇಟ್ಸ್ ಪ್ರಾಬಬ್ಲಿ ಬಿಕಾಸ್ ಆಫ್ ದಿ ಎನ್ಫೋರ್ಸ್ಮೆಂಟ್ ಎಫೆಕ್ಟ್, and the use rates are lesser in highways and in inner roads. Is it because of lack of enforcement effect? We do not know. Nevertheless, cap helmet is the preferred choice among all the pillion riders and youth riders. So all the youth, all the pillion, they are allowed to use cap helmet. Standard helmet use is very less among females. There is no weekend or weekday differences. Idu helmet alli ನಾವು ಈ ಸರ್ವೆಯಿಂದ ಬಂದಿರೋ ಫಲಿತಾಂಶಗಳು. ಸೀಟ್ ಬೆಲ್ಟ್ ನೋಡಿದಾಗ 60,737 four-wheelers were observed across 15 locations between February and March 2022. And what did we see? We see that 66% of the drivers used seat belt. 66% of the drivers used seat belt. The front passenger sitting next to the driver, 16% used seat belt. I am not giving statistics for the rear passengers because the rear passengers rarely use the seat belt. It was around 0.6%. So adike nanu torsilla. So it's around 0.6%. So the seat belt use, if you look at, it's a very interesting finding that from this, lightweight trucks, pickup trucks, Bolero, 207, 407, itara gaadigalu. So the light pickup trucks, the minibus, you see their seat belt rates are very, very less. I would like to revisit this point later. Their seat belt rates, the average seat belt use is 66%, but their use rates is only around 38% and around 42%. The commercial vehicles, trucks seat belt use is very less and also less in the inner roads. Then males, females also more or less the same time. There is not much of a difference between males, females and different time of the day. In short, the seatbelt findings are 6 out of every 10 drivers, they use a seatbelt, but only 1 or 2 out of every front passengers use seatbelt. Rear passengers, they rarely use a seatbelt. Commercial vehicles, only seatbelt use is very, very less, just 30 to 40%. Female driver seatbelt use is higher. So there's similar rates by the time of the day and also by the weekend. So the last risk factor that we assessed was speeding. So we faced a lot of challenges in doing the speeding assessment, right from procurement of the equipment. And also this is something new that also NIMANS was doing. NIMANS has been doing with respect to seatbelt and helmet, but speeding is also something new that NIMANS has started. So after intensive training, night and daytime speeding assessment was done. 8 locations are completed. So whatever the results that I am presenting today, it refers to the 8 locations. Also, the results should be viewed from this background information. 30 km speed allodre 5% chance ಇದೆ ಸಾಯಕ್ಕೆ. 48 km speed ಅಲ್ಲಿ ಗಾಡಿ ಓಡಿದ್ರೆ almost 45% chance ಇದೆ ಸಾಯಕ್ಕೆ. 65 km/h speed ಅಲ್ಲಿ ಗಾಡಿ ಓಡಿದ್ರೆ almost 85% chance ಇದೆ ಮನುಷ್ಯ ಸಾಯಕ್ಕೆ. ಇದ್ರ ಮೇಲೆ ಹೋದ್ರೆ almost 100% ಆಗುತ್ತೆ ಚಾನ್ಸ್. So the risk for death during an event of crash, it increases exponentially with increase in speed. With this background, I would like to present the results because the results were very, very interesting for us. We almost used the same sites. We could not use the same sites for speeding assessment because the criteria for the site to be selected for speeding is different for the criteria to be selected for observation of helmet and seatbelt use. We needed a long stretch without barriers, and it has to be away from schools, colleges, tourist spots, and those kind of things. So following the criteria, we had to make some changes, and the places marked in blue, we will share the presentation. They are the roads that are different for speeding. So what did we observe? As of 10th July, 67,347 vehicles were observed. The average speed was observed to be 45 km/h. So 45 km/h, 40% chance if it crashes. So if anybody crashes even at 40, there's close to 40% chance. And during the daytime, the average speed was around 44 km/h, whereas in the night time, there was almost nearing 3 kilometers increase, 47 km/h. So it looks to be okay if you look at this slide, but it's not okay when we start going deeper, when we start breaking the speed by type of vehicles. If not where the average speed is 45 km/h considering all vehicles. But if you start going, if you look at our light pickup trucks and cars, the average speed is 50 and 49 km/h. Average, talking about the average speeds. So if you see what proportion were overspeeding according to their prescribed vehicular speed limit, nearly 1/3 of all the vehicles were overspeeding according to the prescribed vehicular speed limit. And every 50% of all these light trucks, they are overspeeding. First, the seatbelt use is very less, then their average speeds are higher, and 50% of them are overspeeding. This is one of the important risk factor group that is emerging from this particular assessment. Every second light commercial vehicle is overspeeding. 1/3 of all motorcycles, cars, autos, and trucks are overspeeding. So light trucks are an important risk group. What is the average speed if you start breaking down by the type of road? What we observed was the speeds in highway on an average, they are around 20 kilometers higher than speeds in arterial roads, especially the cars and the light trucks. If you see, this is normal road, this is highway. Highway almost speed 20 kilometer average agi ಜಾಸ್ತಿ ಆಗುತ್ತೆ. So speed ಜಾಸ್ತಿ ಆಗ್ತಾ ಇದ್ದಂಗೆ accident chance ಆಮೇಲೆ ಅದರಿಂದ ಜೀವ ಹೋಗೋ ಚಾನ್ಸ್ ಕೂಡ ಜಾಸ್ತಿ ಆಗುತ್ತೆ. So highway average speed is higher in highways. The speed of cars, light trucks, and SUV and minibus increases by 40 to 90%. Light trucks with minimal safety have got the highest increase in speed. So there is a chance that we expect more fatalities in this age group. Average speed between arterial roads and inner roads is more or less the same. So highway is very important from the speeding perspective. So if you see ಎಷ್ಟು change ಆಗಿದೆ ಅಂದ್ರೆ ಇಲ್ಲಿ ನೋಡಿ highway go arterial road go on an average 19 km/h difference ಆಗುತ್ತೆ, ಜಾಸ್ತಿ ಆಗುತ್ತೆ speed. Change is nearly 29 km/h for cars and light trucks and 17 kilometers for motorcycles and other vehicles. And it's not only just change. If you look at these, the standard deviation, 74 plus 14, almost 90 kilometers. So on speeding matrix, what percentage of people are basically over speeding? We see that proportion of vehicles are actually over speeding than the prescribed speeding limit. So brake model 0 to 20 is 21 to 40, 41 to 50, 51 to 60. Now brake model now 50 kilometers of bracket built. But overall, what I want to say is majority of the vehicles in Bangalore are traveling between 21 to 50 kilometers per hour, implying that their risk for crash and death is also a little lesser. There is scope for reducing the average speed to the left and further reducing the risk.
Gautam, what is that last line which is totally red?
The last line which is yellow is what proportion of
Next, before that.
What before next line.
Next.
That last
Other
line.
ಅಂದ್ರೆ ಈ JCB.
Sir, other is basically other vehicles are JCBs, tractors, road rollers. Their prescribed speed limit is 20 kilometers per hour, but 82.7% of them are overspeeding because they are moving at a rate of 30 kilometers.
In fact, they've seen so many crashes recent time.
Yes,
These vehicles,
Yes.
The garbage
carrying vehicles, all this.
Since the numbers are less, I didn't want to cover 110 vehicles observation.
I was wondering. That entire line is red. So what is that?
Yes. So it's other vehicle, JCB and others.
Okay.
So to end here, we would like to say that I have summarized most of the things. That average vehicular speed is 45 kilometers. Night time speed is 3 kilometers more than daytime speed. The light pickup trucks are having a high average speed, followed by cars, SUVs, and motorcycles. In this survey, SUV was used as a separate category, sir, and I think it's interesting because SUVs, they are the upcoming market now. The large proportion of vehicles, the car buyers are buying SUVs, and SUVs are having an higher average speeds. They are more heavier than the cars. The risk of fatality is also going to be higher.
But how did you find out in the BBMP limits almost 30 kilometers fast is there now? Average. Now, how did you find out with all these vehicles in the BBMP area? Because everything is slow moving traffic only.
Yes, sir.
How do you find that?
We have by time of the day.
Now, if it is a long stretch like airport road, or if you take any long stretch of ring road or a nice road, you can able to find only these roads, not in this.
No, sir. What we have done is this session wise. The day is if you start at morning 7 o'clock, so traffic will be less. That time the average speeds are almost equal to night time speeds. So when you come to peak hour, it is coming lesser, 20-30 kilometers per hour. Speed just. So we have just observed what is happening.
Peak time.
Yes, sir, peak time. Peak time also we have observed, and peak time the speeds are little lesser than early morning and night.
So usually 9 to 12 and 4 to 8. That's the peak timings. And our time only different type of roads will have different speeds. Not all roads will have the same speed.
So we have
Depends on the
it depends.
Yes, sir. We can give the breakup of by the time. What is the speed level, even by the type of road also. So
That is very much required.
yes, sir.
Enforcement.
Yes, sir.
It is very much required.
We can give the data is that we can give that information, sir.
One minute. ನಮ್ಮ ಟ್ರಾಫಿಕ್ ಸ್ನೇಹಿತರು ತಮ್ಗೆ ಏನಾದ್ರು ಡೌಟ್ಸ್ ಇದ್ರು ಕೂಡ ಇಲ್ಲ ಕ್ಲಿಯರ್ ಮಾಡ್ಬೋದು. ತಾವ್ ಸುಮ್ನೆ ಕೂತಿದ್ದೀರಾ, ನಾವು ಮಾತ್ರ ಕೇಳ್ದಂಗ್ ಆಗ್ತದೆ. ತಮ್ಗೆ ಏನಿದ್ರು ಮುಕ್ತ ಮನಸ್ಸಿಂದ ಕೇಳ್ಕೊಡಿ. ನಮಗೂ ಕ್ಲಾರಿಫೈ ಆಗುತ್ತೆ, ನಿಮ್ಗೂ ಕ್ಲಾರಿಫೈ ಆಗ್ತದೆ.
ಜೊತೆಗೆ ನಿಮ್ದು ಏನಾದ್ರು ಇನ್ಪುಟ್ಸ್ ಇದ್ರೆ ಅದನ್ನು ಸಹ ಹೇಳಿದ್ರೆ.
ನಿಮ್ಮ ಅಬ್ಸರ್ವೇಷನ್ ಹೇಳ್ರಪ್ಪ.
ಓಪನ್ ಆಗಿ ಹೇಳಿ, ಹಾಗೆ ಕೂತಲ್ಲೇ
ಈಗ ಫಾರ್ ಎಕ್ಸಾಂಪಲ್ ನಾವು ಹೇಳ್ತಾ ಇದೀವಿ, ಈಗ ಬೊಲೆರೋ ಆಮೇಲೆ ಲೈಟ್ ಟ್ರಕ್ಸ್ ಎಲ್ಲ ತುಂಬಾ ಜೋರಾಗಿ ಹೋಗ್ತಿದೆ, ಅವ್ರು ಸೀಟ್ ಬೆಲ್ಟ್ ಹಾಕಲ್ಲ ಅಂದ್ಬಿಟ್ಟು. ಸೊ ನೀವು ಅದೇ ನೋಡಿದೀರಾ ಅಥವಾ ನೀವು ಬೇರೆ ಏನಾದ್ರು ನೋಡಿದೀರಾ?
ಮೇಜರ್ ವೆಹಿಕಲ್ಸ್ ಕಾರ್ಸ್ ಕಾರು SUV ಹೊಸ ವೆಹಿಕಲ್ಸ್ ಏನ್ ಬಂದಿದೆ ಅವರು ಸೀಟ್ ಬೆಲ್ಟ್ ಹಾಕಿರ್ತಾರೆ, ಬಟ್ ಸ್ಪೀಡ್ ಜಾಸ್ತಿ ಹೋಗ್ತಾರೆ ಅದೊಂದು. ಮತ್ತೆ ಈಗ ನಮ್ಮ ಜಾಯಿಂಟ್ ಸಿಟಿ ಸಾಹೇಬರು ಡೈರೆಕ್ಷನ್ ನಾವು ನಿನ್ನೆ ಇದು ವಿಶೇಷ ಕ್ಲಾಸ್ ತಗೊಂಡಿದ್ದೀವಿ. ಎಲ್ಲ ಶಾಲೆ ಮತ್ತು ಕಾಲೇಜುಗಳಿಗೆ ಭೇಟಿ ಕೊಟ್ಟು ಮಕ್ಕಳಿಗೆ ಗಾಡಿ ಕೊಡಬಾರದು, ಮತ್ತೆ ಮಕ್ಕಳು ಕಾಲೇಜಿಗೆ ವೆಹಿಕಲ್ಸ್ ತರಬಾರದು ಅನ್ನೋ ಒಂದು ಇನಿಷಿಯೇಟಿವ್ ಟೈರು ಇದು ಮಾಡಿ ಅದನ್ನು ಕೂಡ ಮಾಡುತ್ತಿದ್ದೀವಿ. ಅದರ ತಾವು ಯಾವ್ದಾದ್ರು ಒಂದು ಪ್ರೋಗ್ರಾಮ್ ಮತ್ತೆ ಈ ಟಿವಿ ಚಾನೆಲ್ಸ್ ಅಲ್ಲಿ ಅಡ್ವರ್ಟೈಸ್ಮೆಂಟ್ ಕೊಡ್ತಾರ ಅದನ್ನ ಮಾಡಿದ್ರೆ ಜನಗಳಿಗೆ ಅವೇರ್ನೆಸ್ ಬರುತ್ತೆ ಅಂತ ಸಜೆಷನ್. ಸರಿ,
ಸೊ ಈ ಫಲಿತಾಂಶ ಕುರಿತು ನಿಮ್ಗೆ ಏನಾದ್ರು ಕೇಳೋದಿದ್ಯಾ, ಹೇಳೋದಿದ್ಯಾ? ಇದು ಸರಿನಾ ಅಥವಾ ಸರಿ ಅಲ್ವಾ, ಅಥವಾ ಇನ್ನೂ ಜಾಸ್ತಿ ಏನಾದ್ರು ಇನ್ನು
ಈಗ ಅವ್ರೇನ್ ಅಧ್ಯಯನ ಮಾಡಿದ್ದಾರೆ ಅದ್ರ ಬಗ್ಗೆ ನಿಮ್ಗೆ ಏನಾದ್ರು ಸ್ಪಷ್ಟತೆ ಬೇಕು ಅಂದ್ರೆ, ನಿಮ್ಗೆ ಏನಾದ್ರು ಅನುಮಾನ ಇದ್ರೆ, ನಿಮ್ಮ ಪ್ರಶ್ನೆ ಇದ್ರೆ ಒಂದು, ಅಥವಾ ಇದಕ್ಕೆ ಪೂರಕವಾಗಿ ಇಲ್ಲ ಸರ್ ನಾವು ಫೀಲ್ಡ್ ಅಲ್ಲಿ ಇದನ್ನ ಅಬ್ಸರ್ವ್ ಮಾಡಿದೀವಿ, ಇದು ನಿಮ್ಮ ಅಧ್ಯಯನದಲ್ಲಿ ಮಿಸ್ ಆಗಿದೆ, ಇದನ್ನು ಕೂಡ ಸೇರ್ಸ್ಕೊಳ್ಬಹುದು, ಅದನ್ನು ಕೂಡ ಹೇಳ್ಬೋದು. ಯಾಕಂದ್ರೆ ಅವರು ಏನ್ ಮಾಡಿದ್ದಾರೆ, ಜಾನ್ ಹಾಪ್ಕಿನ್ಸ್ ಯೂನಿವರ್ಸಿಟಿ ಮತ್ತೆ ಏನೇನು ಬೇರೆ ಯೂನಿವರ್ಸಿಟಿ ಇದೆ ಅಲ್ಲಿಂದ ಯಾವ ರೀತಿ ಸ್ಟಡಿ ಮಾಡಬಹುದು ಅನ್ನುವ ಒಂದು ಮಾಡೆಲ್ ಇಟ್ಕೊಂಡು ಮಾಡಿದ್ದಾರೆ.
ಸೀಟ್ ಬೆಲ್ಟ್ ಕಾರ್ಗಳು ಈ ಎಲ್ಲೋ ಬೇಡ ವೈಟ್ ಬೋರ್ಡ್ ಅಂತ, ಅಂದ್ರೆ ಎಲ್ಲೋ ನೋಡಿದ್ರೆ ಎಲ್ಲೋ ಹಾಕ್ತಾರೆ, ಅಂದ್ರೆ ಭಯ ಅಂದ್ರೆ ನಮ್ಮ ಪೊಲೀಸರು ಬರೀಕೋಸ್ಕರ ಏನೋ ಫೈನ್ ಹಾಕ್ತಾರ ಅಂತ ಹೇಳ್ಬಿಟ್ಟು ಹಾಕ್ತಾರೆ ಅವರು. ಬಟ್ ವೈಟ್ ಬೋರ್ಡ್ ಜಾಸ್ತಿ ಸೀಟ್ ಬೆಲ್ಟ್ ಯೂಸ್ ಮಾಡಲ್ಲ ಸರ್, ಎಲ್ಲೋ ಬೋರ್ಡ್ ಎಲ್ಲ ಮಾಡ್ತಾರೆ. ಅಂದ್ರೆ ಭಯ, ನಮ್ಮ ಪೊಲೀಸರು ಭಯಕ್ಕೋಸ್ಕರ ಆದ್ರೂ ಏನೋ ಫೈನ್ ಹಾಕ್ತಾರಪ್ಪ ಇವರು ಅಂತೇಳಿ ಎಲ್ಲೋ ಬೋರ್ಡ್ ಯೂಸ್ ಮಾಡ್ತಾರೆ. ಬಟ್ ವೈಟ್ ಬೋರ್ಡ್ ಅವರು ರಿಯಲ್ ಸರ್ ಸೀಟ್ ಬೆಲ್ಟ್.
ಸೊ ಅದು ನೀವು
ಬಹಳ ಇಂಟ್ರೆಸ್ಟಿಂಗ್ ಇರೋದು. Those drivers, what he means, yellow and white board you must be knowing. Taxi drivers, they use seat belt because if they are fined, they have to pay from their hard earning. Those who are white boards, they are really rich or middle class. They even don't bother to pay the fine. That is the attitude, that is the mentality of road users. That's what it
We
means.
could request that if whatever classification of vehicle that might be for enforcement, for road safety perspective, everybody should. So is there something can be done for ensuring that both class of vehicles should wear?
We should our target group should be different during enforcement, yes.
Yeah.
Then only it is possible.
ಆಮೇಲೆ
but if you look at the data,
Yes, sir.
see most of the cars are using seat belts. Commercial driver ಇರ್ಬೋದು, ಅವ್ರಿಗೆ ಇನ್ನೂ ಜಾಸ್ತಿ ಭಯ ಇರುತ್ತೆ,
ಅದೇ
ಫೈನ್ ಜಾಸ್ತಿ ಆಗುತ್ತೆ.
What does he mean?
But to add to that, most of these trucks and mini trucks are also commercial vehicles.
But unfortunately, we are not enforcing. We are not enforcing. And they are also not bothered because they know that even if they hit somebody, they will not die. They may hit a car, they may hit a two-wheeler. The intensity will not be so much on them or against their vehicle. They will not die. It is the assurance. Therefore, enforcement should also be more against them. That is what your study is pointing.
Almost just 42%.
Yeah.
Very, very.
Enforcement is also less against them. That is the.
In addition, from what we see in the newspapers and on television channels, there is always a general discussion that traffic in Bengaluru is coming to a standstill. Traffic congestion, 10 kilometer speed ಅಲ್ಲಿ ಹೋಗುತ್ತೆ, 20 kilometer speed ಅಲ್ಲಿ ಹೋಗುತ್ತೆ, ಗಾಡಿಗಳು ಮೂವೇ ಆಗಲ್ಲ, ಮುಂದಕ್ಕೆ ಹೋಗಲ್ಲ, ಎಲ್ಲಿದೆ ಸ್ಪೀಡು ಅಂತ. these are common points. But actual data shows that there is always an increase in speed, but it varies by age group, by type of road and the time of the day.
Yeah.
So enforcement officials ಗೆ ಇದು ಹೆಲ್ಪ್ ಆಗಬೇಕು, ಯಾಕೆಂದ್ರೆ their enforcement strategy can be slightly changed to focus more on those selective target groups. That will be useful.
Yes, sir. Absolutely correct, sir. What Sir stated about it.
And on the contrary, we also believe that I also did a double cross check thinking how we can have an average speed of 40 kilometers per hour. But actually,
It is true.
It is true.
Why? Because even in the morning, if you take the accident rate in the morning, accident rate during night is more. Deaths in the morning is more. Deaths in the night is more. Even Niman's
Yes.
receiving the head injuries.
Head injuries is very high
in the morning and
night times.
That is because of the speeding. And that is because during night, they think there will be no enforcement. Looking at this, we are deploying smart enforcement in 50 junctions. And 50 junctions in next August, last week, coming August last week, it is all going to be smart enforcement. 24/7 enforcement will be in place in all these 50 junctions. The study is really reflecting what is happening on the ground. I appreciate it. As they rightly pointed out that people think that there is no movement of traffic at all. And they are giving that picture. Even if we ask them to stop for overspeeding, they will ask these questions to our officers. Then sir, Bengaluru now, even they call us and complain. Even some people, so-called influential, they will call us and ask these questions. And sir, Bengaluru 20-25 kilometers are stable. But this study shows the real picture, what is happening at the ground level. Therefore, the study also indicating what should be our target groups, roads, and timing. Timing is in the peak hour, even maybe in the ring road, the average speed may come down around 60. But during night, that is early morning and later part of the night, it may be more. The speed may be more. Therefore, our target of these speeding vehicles should be in the morning and late night.
Yes, late night, especially after 10-15, because the proportion of vehicles moving beyond 60 kilometers per hour
It is more.
Yes.
Because there is a speed limit there in the overall.
In future, I think technology will take part of it. They will
And
act as
that is the only way out, because now our experience with technology and evidence-based enforcement is that we have also deployed ANPR cameras.
Yes.
Now 20 cameras are there, we are getting another 10 and another 77 cameras we are going to get. Previously, enforcement part I am talking. You finished your this?
Yes, sir.
Finished.
Just challenges from the.
Please.
Yeah, challenges partly it was staff attrition related challenges and environment related challenges. And security issues were there in some instances. I communicated to sir, and sir was saying he would even depute plainclothes policemen, but we just changed the site. The way forward here is that we need to coordinate with the transport department, because we got to know a little late about the larger BRS program. Subsequently, we went and met the additional commissioner, and now every month we are going to have a meeting with the transport as well as police department and present what has happened, and then take the suggestions and move on to the subsequent month. And the next thrust is to develop technical documents and publications so as to disseminate it to the wider public as well as the scientific community, so that people can take evidence-based actions. And the next step, as sir told, was as a part of the commitment with the government of Karnataka, is to expand this observational studies to the Bengaluru metropolitan region. We have just finished the process of sampling, and the next step is to finalize these sample locations with the Karnataka Road Safety Authority. And last time in the meeting, sir was suggesting that mobile phone is an important risk factor that is also needs to be included, and we are in talks with Johns Hopkins to see how we can include that as well. And lastly, I personally feel that there's a need for, we can do a lot of scientific studies, but there's need for a lot of advocacy programs using these studies. Once there's advocacy programs, there is noise, and when there is noise, there is some small amount of thought for change. With small amount of thought for change, a very minute people will change it, but that is very, very important. So we had conducted one program along with sir regarding the cap helmet use. 3-4 days on TV, it made a lot of noise, but even if it has changed 1%, it is a big achievement. With this, I conclude. Thank you very much for your patient hearing.
This will, my request is this has to bring it to public domain, just whatever the research findings and all.
Yes, sir.
So that people also must understand what exactly happening. They have to look into that, the analysis.
Yes, sir. Initially,
We bring it to that by providing the publications and all in the newspapers. Because we only understand, but what about the road users?
Public.
They have to understand.
So a lot of press had inquired us whether they could be a part of this meeting. But then we decided that first we present the results to the key chairpersons and stakeholders.
Next time.
Also, with your permission only, it will be disseminated.
It can be disseminated.
Please give this study results to the media so that it should be in a presentable form to the readers and viewers.
Not this.
True. So that people can understand easily and with some accidental related deaths. Your study and accidents and deaths. It is also going to make a big impact. But it's a good study, I appreciate it. Thank you.
ಧನ್ಯವಾದಗಳು ಸರ್, ಥ್ಯಾಂಕ್ ಯು. ಡಾಕ್ಟರ್ ಗೌತಮ್ ಅವರು ಈಗ ಬೆಂಗಳೂರಿನಲ್ಲಿ ಯಾವ ರೀತಿಯ ಸಂಶೋಧನೆ ಮಾಡಿದ್ವಿ, ಅದರ ಆಗುಹೋಗುಗಳೇನು, ಪರಿಣಾಮಗಳೇನು ಅನ್ನೋದ್ರ ಬಗ್ಗೆ, ಜೊತೆಗೆ ಅಧ್ಯಯನದಲ್ಲಿ ಮೂಡಿ ಬಂದಂತಹ ಏನು ಫೈಂಡಿಂಗ್ಸ್ ಇದೆ ಅದರ ಬಗ್ಗೆ ವಿಸ್ತೃತವಾಗಿ ನಮ್ಗೆಲ್ರಿಗೂ ಪ್ರಸ್ತುತಪಡಿಸಿದ್ರು. ಇದರ ಆಧಾರದ ಮೇಲೆ ಮತ್ತು ಇನ್ನೂ ಹೆಚ್ಚಿನ ಮುಂಚಿನ ಕೆಲಸಗಳು ಏನಾಗಿದೆಯೋ ಅದರ ಆಧಾರದ ಮೇಲೆ ಮುಂದೇನು ಎಂಬಂತಹ ಒಂದು ಪ್ರಶ್ನೆಗೆ ಉತ್ತರ ರೂಪದಲ್ಲಿ ಈಗ ನಮ್ಮ ರಸ್ತೆ ಸುರಕ್ಷತಾ ಕಾರ್ಯಕ್ರಮಗಳು ಮತ್ತು ಇಂಜುರಿ ಪ್ರಿವೆನ್ಷನ್ ನಲ್ಲಿ ಬಹಳ ದೊಡ್ಡ ಹೆಸರು, ಜೊತೆಗೆ ಮುಂಚೂಣಿಯಲ್ಲಿ ನಿಂತಕ್ಕಂತ ಒಬ್ಬ ವ್ಯಕ್ತಿ ನಮ್ಮ ಡಿಪಾರ್ಟ್ಮೆಂಟ್ ನಲ್ಲೇ ಇದ್ದು ನಮ್ಗೆ ಇವತ್ತಿಗೂ ಮಾರ್ಗದರ್ಶಕರಾಗಿ ಕೆಲಸ ಮಾಡ್ತಿರ್ತಕ್ಕಂಥ ಡಾಕ್ಟರ್ ಗುರುರಾಜ್ ಸರ್ ಅವರಿದ್ದಾರೆ. ಸರ್, ವೆಲ್ಕಮ್ ಟು ಯು ಅಂಡ್ ಓವರ್ ಟು ಯು ಫಾರ್ ದ ಪ್ರೆಸೆಂಟೇಷನ್ ಸರ್. ಥ್ಯಾಂಕ್ ಯು ವೆರಿ ಮಚ್.
ಥ್ಯಾಂಕ್ಸ್ ಪ್ರದೀಪ್. ಎಲ್ಲರಿಗೂ ನಮಸ್ಕಾರ. ನಾನು ಆಗ್ಲೇ ಸರ್ ಜೊತೆ ಮಾತಾಡ್ತಿದ್ದಾಗ ಹೇಳ್ತಾ ಇದ್ದೆ, ಫೀಲಿಂಗ್ ಸೋ ಹ್ಯಾಪಿ ಅಬೌಟ್ ಟುಡೇಸ್ ಪ್ರೋಗ್ರಾಮ್ ಅಂತ. ಫಾರ್ 2 reasons. ಬಹಳ ದಿವಸಗಳ ಮೇಲೆ ನಿಮ್ಯಾನ್ಸ್, ಬ್ಯಾಂಗ್ಳೂರ್ ಸಿಟಿ ಟ್ರಾಫಿಕ್ ಪೊಲೀಸ್, ಕರ್ನಾಟಕ ಸ್ಟೇಟ್ ರೋಡ್ ಸೇಫ್ಟಿ ಅಥಾರಿಟಿ, ಆರೋಗ್ಯ ಇಲಾಖೆ ಮತ್ತೆ ಎಲ್ಲರೂ ಸೇರಿ ಒಟ್ಟಿಗೆ ಕೂತ್ಕೊಂಡು ರಸ್ತೆ ಸುರಕ್ಷತೆ ಬಗ್ಗೆ ಒಂದು ಚಿಂತನೆ ನಡೆಸ್ತಿರೋದು ಇದು ಬಹಳ ದಿವಸಗಳ ಆದ್ಮೇಲಿಂದ ಬರ್ತಾ ಇರೋದು. ಯಾವ್ದೋ ಅದರಲ್ಲಿ ಮೀಟಿಂಗ್ಗಳಲ್ಲಿ ನಾವು ಅವಾಗ ಮೀಟ್ ಮಾಡಿ ಮಾತಾಡ್ತಾ ಇದ್ವಿ, ಬಟ್ ಒಟ್ಟಿಗೆ ಕೂತು ಮುಂದೇನು ಅನ್ನೋ ಒಂದು ಪ್ರಶ್ನೆಗೆ ಉತ್ತರ ಹುಡುಕಕ್ಕೆ ಸೇರಿರೋದು ಇದು. ಎರಡನೇದು, ಇವತ್ತಿನ ದಿನ ನಮ್ಮ ಪೊಲೀಸ್ ಇಲಾಖೆಯಿಂದ ಬಂದಿರತಕ್ಕಂಥ ಎಲ್ಲ ಅಧಿಕಾರಿಗಳನ್ನ ನಾವು ನೋಡಿದಾಗ ಬೆಂಗಳೂರು ಸಿಟಿನಲ್ಲಿ 2010ರಿಂದ ಬಿಟ್ವೀನ್ 2010 and 2015 ಬ್ಯಾಂಗ್ಳೂರ್ ಸಿಟಿ ರೋಡ್ ಸೇಫ್ಟಿ ಪ್ರೋಗ್ರಾಮ್ ಅಂತ ಮಾಡ್ತಾ ಇದ್ವಿ. ಅದರಲ್ಲಿ ಇದ್ದವರು ಕೆಲವರು ಇವತ್ತಿಗೂ ಇರಬೇಕು, ಅಲ್ಲಿ ನೋಡ್ತಾ ಇದ್ವಿ. ಆ ಕಾರ್ಯಕ್ರಮದಲ್ಲಿ ಇಲಾಖೆಯ ಎಲ್ಲ between 2010 and 2015, for 5 years under the Bangalore Road Safety Program, we used to interact with city police, transport, health, education, law and welfare departments. And it was a 5-year continuous program with support from WHO, ICMR and Government of India, Ministry of Health. We have some officers who are part of the program where there were joint training programs, orientation programs, advocacy programs, campaigns, all based on data and evidence, which we used to collect on a regular basis from both Bangalore City Police and from 25 hospitals in Bangalore, using common uniform protocols. And that data used to be analyzed and then presented, discussed, and we used to formulate some actions for the next year. So I'm reminded of those days, and it's nice to get back those days under your leadership, sir. For the next few minutes, what I plan to do is basically, okay, we have heard from Dr. Gautam about what we saw about helmets, seat belts, child restraints, even though there was nothing much in that area, as well as speeding. But the question which obviously comes to the mind is, okay, what next? Where should we go from here? One of the things we need to recognize is that basically there is a huge difference between high-income countries and low-middle-income countries when it comes to road safety. There are a number of factors which contribute for this. It's not just one or two, starting with the importance we give for road safety. We give huge importance for traffic management, transportation, and for mobility purposes. But when it comes to safety, it always takes a back seat. And there are many other things. So we need to use local data by the local departments and action by the local people. that can make a big difference in what we do. I also want to slightly expand the scope of this presentation by Gautam to the larger Bengaluru as well as to Karnataka state in the coming days in terms of what are some areas that we need to give importance for. If you look at the whole thing, we all know these factors. It is the younger age groups and it's the males. Like Sir said already, it is the two-wheeler riders, pillions and pedestrians, and even to some extent bicyclists who account for nearly 70 to 80% of deaths, injuries. It varies across geographical places. The rural areas and districts, state and national highways, they are all at very high risk. We always talk about cities. But cities, if you look at the National Crime Records Bureau data, they account for only 20% of the total road deaths and injuries. 80% occurs in rural areas and on state and national highways. And most significantly, it is the poor and the middle-income families that are affected most. The rich families, higher income groups can always overcome this, but the poor and middle-income families are very important. This is the story of Karnataka over the last 10 years. This is the data from the official agencies itself. About 10,000 families are wiped out every year in road crashes in the state. On an average, this is from the official agencies, which says 10,000 families are wiped out because one or more members in the family die in a road crash. The number of those who are injured is less. I'll come to this point a little later. Karnataka's population is about 60 crores, and we have 6 crores, sorry, and we have about 27 million vehicles that ply on the streets. If you look at Bengaluru, the story for the last 10 years, we had about 700 plus deaths in 2011. We had about 651 in 2021. The last 2 years reduction is mainly because of COVID. But at the same time, if you see the vehicles, there is a fourfold increase in the number of vehicles over the last 10 years. 4 times the number of vehicles has increased. Similarly, the number of those who are injured, that number is less. Like Sir said, it is 1:10, but the 5 years of Bangalore Road Safety Program data between police and hospitals showed the ratio to be 1:30:80. For every death, 30 people get admitted to hospitals, and about 80 people, they come to the emergency rooms for minor injuries. And how many go home without taking care, we still don't know. There are minor aberrations and minor things. What we need to recognize is that it's not only deaths. Deaths are only what we call the tip of the iceberg, but we have injuries that require hospitalization. They are admitted anywhere between 2 hours to 30 to 60 days in hospitals, depending on the nature of injury. It can be fracture, it can be brain injury. Our neurosurgery colleagues, Dr. Dhaval is here. He can say there are many people who go on ventilators who just have to be kept there. There's nothing that can be done. And then we have people who get admitted for shorter periods of time, injuries that are treated in small healthcare centers, nursing homes, doctors' clinics, family clinics, those things, and injuries that do not require attention in a health institution, which are very minor. So obviously, when we discuss about road traffic injuries, we talk about deaths. 900 deaths in Bangalore, so what? But it's not 900 deaths. It is this number. In Bangalore itself, even if we take 900 deaths, there will be about 3,000 hospital admissions, about 90,000 persons with minor injuries, and about 2,000 persons with disabilities. In fact, the data has shown, our own data from the TBI registry shows that 10 to 20% of brain injured persons with mild brain injuries can have long-term sequelae that
interferes in their memory, cognition, understanding, information processing, speech, hearing, many other areas. So 2,000 are those who require major disability interventions, but many more would require other types of interventions. Karnataka, if we see about 12,000 deaths every year, about 3.5 lakh people get admitted to hospital. These are admissions, what I'm talking. And then there are other people. So apart from pain and suffering, the economic costs are also huge. Recently, last year, before the COVID, we did a study with the patients who are admitted in one of the private hospitals in Bangalore. A person who gets admitted in a private hospital, whether it's a medical college or a nursing home or a corporate hospital, spends 2 lakhs average. And we can multiply this for the total numbers and calculate what is the economic cost just in the city of Bangalore. And it will turn out to be a huge number. In Sumaru, 1/3 of the crashes, people die on the spot. Nothing can be done for them. They die immediately. So all the other measures will have to be worked out. About 10 to 15% they die when they are going to a hospital, when they are in transit. And about 50% they die in the hospital. And our prevention and our intervention strategies need to take care of this and come up with very clear solutions in terms of what should be done where. This I have mentioned earlier. Whichever study we look at, over time, it is the pedestrians, two-wheeler riders, and pillions and bicyclists. We've been talking about road safety for quite some time, but we are not the only country on this earth doing road safety. All 190 countries around the world are doing road safety work. What has been learned out of this, and also there is 5 to 6 decades of experience in the field of road safety. Millions of dollars have been invested to understand what is road crash, what should be done for it. So if you look at this new shift in the understanding, one important thing is that we have moved our narrative and dialogue from blaming a human being to looking at the entire system. Because a person on the road is a part of the larger system. Entire interventions are being developed based on the human body and the energy transfer. That is a central core issue. How much of an energy an individual can take and still survive without damages to body organs. If I am hit by a two-wheeler when I am on the road, which is coming at 20 kilometers, nothing might happen to me. But when I am on the road and if I am hit by a BMTC bus coming at 80 kilometers, I may not survive. It's primarily the energy related issues and how do we make this energy production and distribution less is the scientific basis all over the world in terms of what needs to be done. Local knowledge needs to inform the implementation of local solutions. Global lessons are important. There's a lot that can be learned. But like Sir said rightly, we need to look at the local data, understand, put it in the local context, and then find solutions for that. And that pays very rich dividends. And so many developments have happened over time. This is a very interesting graph, which I always have loved in the last so many years. You can see this graph, it shows something happened around 1970s to 1980s all over the world. This data from about 25 countries. All 25 countries' data show only one thing, that it went up around 1970s and then started coming down. And this graph ends at 2010, but I just wanted to highlight this particular point. What is it that happened in 1970s to 80s in the world? Gradually, the whole approach to road safety changed. It is now what we call the safe systems approach. ಇದನ್ನ ಈಗ ಪ್ರಪಂಚದ ಎಲ್ಲಾ ದೇಶಗಳಲ್ಲೂ ಒಂಥರ ಒಪ್ಪಿಕೊಂಡು ಎಲ್ಲರೂ ಇದನ್ನ ಮಾಡ್ತಾರೆ.
ಈ ಸೇಫ್ ಸಿಸ್ಟಮ್ಸ್ ಅಪ್ರೋಚ್ ಅಲ್ಲಿ ಇಲ್ಲಿ ತೋರಿಸಿರೋ ಹಾಗೆ ರೋಡ್ ಸೇಫ್ಟಿ ಮ್ಯಾನೇಜ್ಮೆಂಟ್, safe speeds, safe road infrastructure, safe road vehicles, and safe road users, post-crash care, idellanu saha most important. So what is it that is understood by the safe systems approach? I will just take half a minute to see. Like I said earlier, the human body has a limited ability to tolerate crash before the harm occurs. Like I said, if I am hit by a truck, I will not survive. If I am hit by a bicycle, I will get up and walk. That interaction, that complexity is important. While individuals have a responsibility to act with care, a shared responsibility exists with those who design, build, manage, and use roads and vehicles. Sir gave two examples, one of the roads in Bangalore and the other about the vehicles that are being imported to India. This point which Sir made about vehicles which are manufactured in high-income countries come to India without adequate safety features has been well recognized now. And it needs to be addressed very clearly. Same way, those who design, build, manage, and use roads, they are also equally accountable for the road crashes. And all parts of the system must be strengthened. It's not blaming one another or running away from one another, but everyone needs to come together to strengthen as to how we can save lives on the roads, while at the same time, mobility is also promoted. Today, travel is a basic fundamental necessity for every human being. Nobody can sit at home and do anything. People are waiting for COVID to get over to jump out onto the roads. So travel is important. But safety, mad. Safety is also equally important. So these are the 5 pillars on which road safety currently is addressed all over. A good road safety management, safe roads, safe vehicles, safe road users, and the post-crash care. WHO in 2018 came up with this very interesting report on Save Lives on about 20 points interventions that will save lives. And these are known proven interventions. And speed management is top on that list. And the data that is shown shows the differential speeds on the streets of Bangalore. And most of us who have traveled on highways know how the speeds are on the highways. So speed management measure. Second, leadership on road safety. How agencies, organizations need to show the roadmap and become leaders in this area. Infrastructure design and improvement, vehicle safety standards, enforcement of traffic laws, and post-crash care. In these 6 areas, we need to do many things to put them together to get maximum benefits and results. Like Sir said earlier, road safety is a shared responsibility of different departments. Take just for example, helmets. It's not one department which can solve this problem. That is the point I was trying to make. Everyone has to come together. Situation analysis can be done by academic institutions. Existing law to be seen by the transport department. The law has to be made, that's by the law department. Police will have to be trained and sensitized. That is the police department. Good quality of helmet should be available. In fact, in my last discussion with Sir said, many of the people who are wearing helmets are dying. That's one of the reasons for that is the substandard, poor quality helmets. The moment the person hits the ground, the helmet rips open and there cannot be any protection to that individual. So industry responsibility is that, public awareness again to be done by all, uniform enforcement again by the police. In fact, Bangalore City Police ಅವ್ರಿಗೆ ಅನ್ಸ್ಬೋದು ಎಷ್ಟೊಂದ್ಸರಿ ನಾವ್ ಯಾಕೆ ರೋಡಲ್ಲಿ ನಿಲ್ಲಿಸ್ಕೊಂಡು ಈ ಜನಗಳನ್ನೆಲ್ಲ ನಿಲ್ಸಿ ಇವ್ರಿಗೆ ಬುದ್ಧಿ ಹೇಳಿ ಇವ್ರಿಗೆ ಫೈನ್ ಕಲೆಕ್ಟ್ ಮಾಡಿ ಇವ್ರನ್ನ ಮನೆ ಕಳಿಸ್ತೀವಿ ಅಂತ. ಬಟ್ ನಾನು ಒಂದು ಹೇಳಕ್ ಇಷ್ಟಪಡ್ತೀನಿ, ನೀವು ಮಾಡ್ತಿರೋದು ಬಹಳ ಅತ್ಯುತ್ತಮವಾದಂತ ಕೆಲಸ. ಒಬ್ಬೊಬ್ಬರ ಜೀವನೂ ಒಂದೊಂದ್ ತರದಲ್ಲಿ ರಕ್ಷಿಸ್ತೀರಾ. ಇದನ್ನ ಇದು ಯಾರು ಹೇಳ್ತಾರೋ ಹೇಳಲ್ವೋ ಗೊತ್ತಿಲ್ಲ.
Very good point, bro. Very good point. What I request you is, from Nimans, if you write to me, I will tell them.
Yes.
Tell those who object it.
Yes, I will.
So
Oh.
the important point that you made, it could be helpful for the online partners. as
Yeah.
well.
No, what I was trying to communicate was, Bangalore City Police, over time, we have scaled up enforcement. They have increased the police presence on the roads. They stop people on the roads, and those who don't wear helmets are being challaned and all that. What I was telling was they are doing a great job of saving lives on the roads. Because every time they stop somebody, they stop them, they ask them, they inquire about them, they challan them, they see that next time they wear a helmet, whether it is also because of the police fear, but at the same time they wear a helmet next time. Now with the penalties going up, people are becoming more cautious. They also tell them they're doing a great job. And I think that needs to be appreciated in the long run. And now, we didn't have a Karnataka Road Safety Authority. We have a Road Safety Authority, which also will now get involved and engaged in a very big way doing this. Most of the times we blame the person who just gets engaged in a crash. But this is just one example I am giving. Here is this one of our case studies. One of the motorcycle riders is not wearing a helmet. It's 11 o'clock in the night. He's driving under the influence of alcohol, and he's also going at high speed. So because of the alcohol effect, he cannot balance his vehicle in the normal way. There is an invisible road hump, and it is night time. He has a skid. He falls, has an injury. He's taken to one hospital. Something is not available in that hospital, whether it is doctors or ambulance or X-ray or radiology or something. He's referred to the next hospital. He's referred to the next hospital. When he goes there, they will ask him to deposit 50,000 rupees. He will not have 50,000 rupees. He's sent back to another hospital and ultimately comes and dies there.
When it reaches Marchuri.
Marchuri. The problem is here, there are so many factors that are contributing to this crash. And this requires a good understanding from the crash reports. We need to examine the data, collect data from other places. So there are many things that can be addressed here. If he is wearing a helmet, he could have saved. If he was not drunken state, he would have survived. If there was no road hump, he would not have fallen. And if the hospitals had provided care, he would have survived. So there are many of these factors which are modifiable. And that is what we are trying to aim. We should modify this whole thing. But we end up finally doing only this one. We get all school children to our programs and teach them. And after that, if the program is not continued, it may have a little slow effect. So road safety management has three pillars, mainly institution management, interventions, results. There are several advantages, and overall there are many benefits. So we need to have a strong road safety management under the Karnataka Road Safety Authority in collaboration with many other departments to move the road safety agenda in Bangalore and in Karnataka state. And there are many things that need to be done by the authority, whether it's coordination, legislation, resource mobilization, funding, achieving results, action plans, programs, many things that need to be done, and all based on a research and a technical base. There is data, it should be driven, it should not be individual opinions. Safe roads are an important thing, like sir suggested earlier. We always think of covering one pothole, but the moment we cover one, there is a next one which is coming at 10 feet. So area-wide interventions these are evidence-based interventions which have been proven or many things. There are many low-cost interventions that are effective. Like sir was giving example of junctions. For example, if you just put a roundabout in a place, whether the driver is from Dharwad or from Koppal or from Markera or from Bangalore, he has to come and take a turn and then go. It doesn't matter whether he is educated, not educated, whether he is IT guy or a non-IT guy, because there is a roundabout, he is forced to go. And when he comes there, his speed automatically slows down.
And environmental interventions can make a huge difference. And traffic calming measures, which a few of already of them are on place. Safe vehicles, again, that's an important thing. There are some improvements which have happened over time. We have the anti-braking systems. We have daytime lights for two-wheelers now, which have become mandatory. The wheel dimensions have changed. The road grip features have changed. Similarly, the Bharat NCAP is in the anvil now. Probably in 2023, Bharat NCAP will come with electronic braking system, safety controls, pedestrian safety features, seat belts. Everything is based somewhat on data and other things. If you think of many cars that were there in the past, most of the cars used to have a straight, sharp edge right in the front. If you see today's cars, they all come with rounded front ends. Even when they touch a person, they slide, they don't pierce. And that has happened based on research and data collection. They have studied crash analysis where they recognize the sharp edges of the car used to go and pierce the leg of the individual. They made it rounded. Simple technologies can make a huge difference. The collapsible steering wheels. Many a times when a person, car driver in a crash, goes and hits the steering wheel. But today we have steering wheels which collapse immediately. But like sir was telling, airbags, they don't open up in some cars. And that's a separate point of discussion. But we are talking about only two-wheelers and safer cars. What about other vehicles? The tempos, the many other SUVs or many other vehicles. Where are the standards for them? Even though there are international standards available, how far are we compliant with that is something to be understood. Safe road users on which much is being discussed. These are the 10 areas that are very relevant from a human perspective. We need to have a proper driver licensing system, transport system that accommodates helmet, seat belts, child restraints, alcohol, drugs, speeding, mobile phones, visibility, pedestrian safety, walkability, driver fatigue. Many of the drivers earlier days, they used to drive for 24 hours on long stretches. Now we have two drivers in those buses. One person sleeps, other person drives. There is also a spare driver in some of the other buses for some emergencies. So driver fatigue, sleeplessness, all these are contributory factors, but we need to see what is it that is urgent. So considering all these demands,
many of these things have been addressed already, sir. Still, there are some things to do.
Some have been,
Yes, some are not.
So we programs, we concentrated more on helmet, seat belts, which we call as public health alerts, which are important. So ultimately, what is the best practices that can give results? Every driver should be fit to drive. All two-wheeler riders and pillions should wear standard helmets in the correct manner. And ಅಷ್ಟೇ ಹೇಳಿದ್ರೆ ಜನ ಕೇಳ್ತಾರೆ ಯಾಕೆ ಸರ್ ಯಾವಾಗಲೂ ಹೆಲ್ಮೆಟ್ ಹಾಕೊಂಡು ಓಡಾಡ್ಬೇಕು ಅಂತ ಅದಕ್ಕೆ added while riding ಅಂತ ಅದು ಕೇಳಿ ಯಾರಲ್ಲ ಯಾಕೆ ಸರ್ ಯಾವಾಗಲೂ ಹೆಲ್ಮೆಟ್ ಹಾಕೊಂಡು ಓಡಾಡ್ಬೇಕು. All car occupants should wear properly fitted seat belts while driving. It should be close to 100%. From what Gautam showed, it is somewhere around 65% for driver.
Which one, sir?
Seat belts?
66%.
66% currently in Bangalore. Helmets, if we look at the full face helmets and the half face helmets, it totals up to 65%, but still many, 1/3 are not wearing any helmets. And if we look at the cap helmets or the horse helmets or the bucket helmets, it is much higher number. Absolutely no drinking and driving. More than 80% should adhere to the speed limits. It should be closer to 100% speed limits as specified for that particular road. It's not general for the whole city. Pedestrian street crossing and street walking practices. All roads should have a minimum 3-star rating, which is one of the stipulated global standards. All vehicles should come with safety and are used by people. Because even if there are seat belts, like you said, many people don't use it. So safety features should be used. Child restraint should be used. The airbags should be working. All that needs to happen. And there should be a system for road safety, which is driven by data and evidence
combined with legislation, education, enforcement, and use of technology as such. This is trauma care in India, like I was mentioning earlier. Death on the spot is 1/3, pre-hospital 11%, in-hospital is about 53%. There are many people who are being discharged. There was a very interesting study done between All India Institute, New Delhi, and the Seattle Harborview Medical Center in US. They took the same type of patients who are discharged from the hospital at the same level of severity and then followed them. What is the type of care provided after their hospital discharge? And followed them up for a few months. In US, 2% people died. In Delhi, 28% died. Which means after the care, our rehabilitation programs are still not very strong. And there are a lot of complications that have happened. There are many other problems that happen in the post-discharge period, sepsis, infections, many other organ complications with which people die. And if you look at the trauma care, about 1/3 of the people will have an injury to the head. And face injuries and head injuries, if you put together, that is 2/3. And then upper limbs and lower limbs again is 1/3. Then there are people with injury to the neck, to the chest, to the abdomen, upper limbs, all these areas. 10 good practices in trauma care globally that are known as efficient state coordinating mechanisms, training first responders. Again, in the Bangalore, 5 years of Bangalore Road Safety Program, one of the things we did was train the police in first aid care. What they can do on the road, on the spot, wherever it is possible. Early first aid and safe transportation, stabilization, triage assessment and referral, preparedness of the hospitals, manpower, increasing physical infrastructure. So these are the 10 strong good practices that can reduce deaths during this. So addressing all these key elements is an important thing. Globally, we know if we do helmet, seatbelt, speed, drinking, driving to the 100% capacity, our overall road deaths will reduce by 40%. So even in Bangalore, if we do these things together, we can save 300 lives. Similarly, if we do good trauma care practices, we can reduce about 1/4 of the total deaths. And then helmets, their drink drives, they're all selective in some programs. And the overall benefit is not only with regard to death, it is with regard to hospital admissions, with serious injuries, disabled persons, financial costs to the government. So there is an overall benefit of all aspects connected to road safety with a good road safety system and programs in place. So what's the way forward for this? Like what we should do in Bangalore, in Karnataka, in other cities. We need to choose the right interventions, not everything that everyone says, which are scientifically proven, evidence-based, which are known to work. We need to integrate many things in all our policies, programs, and activities. There is no point in training transport department workers only in license, only in driving, only in road behavior. We need to integrate a lot of these things into many other activities. The most important thing is the implementation. This is where we lack many times. We need to have uniform, visible, random, and people-friendly implementation policies and programs where it is really making a difference. We need to invest in human, technological, financial, and other areas like Sir already said about the whole body cameras and other areas. And these things we know, I'll skip all this. This is the last slide. Karnataka state needs to have a proper framework for road safety, which incorporates all these elements and integrates activities and does them with very full speed. So in that way, we need to look at it in this thing.
Last slide, everyone thinks, oh, road crash happened and person went to hospital and then he is discharged from hospital and he's okay.
But he's not okay. His family is not okay. His known acquaintances are not okay. ಕಡೆಗೆ ಯಾರು ಇರಲ್ಲ. ಇದು we need to understand that it's not a matter of seconds or minutes, even though it happens. I have seen many children who grow up and who have become problem in society over time because their father died in a road crash. I have seen many women become commercial sex workers because her husband died in a road crash. We have seen many orphan children without anyone to take care because their family died in a road crash. So it's a serious problem. We need to look at it. I leave you with this and thank you very much.
Thank you very much, sir. And it is open for discussion. We know that we are at hand late on time. So open for discussion with the chairperson's permission. ನಿಮ್ಮ ಎಲ್ಲರ ಅನಿಸಿಕೆ ಅಭಿಪ್ರಾಯಗಳಿಗೆ ಮತ್ತು ಚರ್ಚೆಗೆ ಈಗ ಅವಕಾಶ.
ನಿಮ್ಮ ಅಭಿಪ್ರಾಯ ಹೇಳಿ, ನಾವು ಒಂದು 10 ನಿಮಿಷ ಚರ್ಚೆ ಮಾಡಿ ಮುಗಿಸ್ಬೋದು.
ನೀವು ಅವರು ಯಾರಾದ್ರೂ ಮಾತನಾಡೋದಿಲ್ಲ. ಅಪರಿಚಿತ ಟೀಮ್, your experience. The floor is open for comments.
I just want to thank Sir, Ganendra Sir, Kemara Sir, and Nimhans and John Hopkins Nishpatek for this opportunity. This was a very good brainstorming, I felt, and the data is here for all of us to look at and all of us to take the evidence-based policy decisions for the government. The initiative is definitely going to work with the government on, all the partners are going to definitely work with the government on each of these factors, each of these risk factors. And yeah, we'll definitely look forward to comments and questions from all of you.
So with regard to that helmet, now the present helmet is of Indian standard, that is 4151 of 2015. The enforcement authority is, the enforcing agency is actually the Bureau of Indian Standards. So very recent, like 2 years back, there was a notification issued by the Ministry of Road Transport and Highways with regard to the enforcing agency for substandard helmets which has been manufactured and sold in the open market. So I made a request to the BIS company to enforce that particular laws, because we are really coming across us in all the roads. There are different, in the streets, they're all placing their substandard helmets. Then they sought the support of the police department. I think last 4 or 5 months back, they have addressed a letter to me with regard to the support of the police department for doing all kind of, finding out this illegal manufacturer and illegal sale of these substandard helmets. I request the police officer, I will just coordinate with them with BIS, Bureau of Indian Standard, and with police to do all kind of checking so that people will very much scared of wearing the substandard helmets. There's one part. Second, my request is change of face from the half helmet or something like that is there, which is not recommended. That has to be changed to the recommended IS standard for 4151, what's called 4151 of 2015, which is a recommended. So that has to be made. So that is also the part of the enforcement staff from the police department, from the transport department. So that has to be taken care of it. This is my request from my side. Because based on the study made by the demands also, I have gone through the study of with regard to helmet, about the manufacturing, how the helmet shape, etc., which is mentioned in the 4151 of 2015. That has to be taken care of. This is my request from my side. As a lead agency, I am requesting the concerned stakeholder departments.
So here I also had a question. In fact, I had a comment. If the government could also enforce the clasping of helmets, because most people just put it on their head, but they don't clasp. Article 129B, as Sir mentioned, It's not being enforced still. A lot of people still don't know whether they are classed or not. And at a point in crash, if it's a high impact crash, sometimes the helmet could fly off. So it just doesn't help the person.
And
That's a good question.
ಅದಕ್ಕೆ ಆಡ್ ಮಾಡಕ್ಕಷ್ಟೇ.
Change from helmet use to standard helmet use.
Yes.
All the issues, wearing a standard helmet as well as strapping.
Standard and correct.
Correct.
Standard helmet,
See,
correct.
We started this special drive. First, we started educating them. As you all know, we are all already a very unpopular Bangalore traffic police among the violators, not among the road users, among the violators. We are very unpopular. Now, first, these police asked us to wear a helmet. Yes, we are wearing a helmet, but still they are stopping and fining us. Then we will tell them. So this is not standard helmet. The second question what they ask, okay, if the government is not interested in seeing all such type of helmets on our head, why these helmets are available on the roads? That is a standard question they ask. We don't have any role to play in that. Because those helmets, industrial type of helmets, it is manufactured, right to manufacture such helmets and sold to and to sell to other purposes. They will keep these helmets on the footpaths. Naturally, the two-wheeler riders will go purchase it and put it. They will also not tell. These people will not also not ask whether this is a standard helmet or not. The first question what they ask is why the government is allowing such helmets to be sold on the roads. Therefore, the mandate is with Weights and Measure Department. They should tell, they should regulate. There is a ticklish part. They will tell them they don't have manpower. We tell them, as a rightly pointed
No,
out,
it's not for that, sir. It's Bureau of Indian Standard. They are.
let them come with us.
Yeah, that I will coordinate, sir.
Because it's a long pending issue.
Yes.
What this data is showing, what our data, what our ad is showing is that even he is wearing a helmet, which is not standard, he is going to be killed. He is only aiding in killing, not protecting him. Therefore, what our request with other agencies, they should come forward based on the data available with police, with the institute like demands. They should tell the people, no, you cannot manufacture such helmets for two-wheeler riders. This is the commitment they should do. Otherwise, people will start blaming us. That's why we have started 6 months back, 8 months back. We did on Facebook Live also. Our social media campaign we are doing. If you see our that is Twitter, our people are doing every day. Every day they will stop, they will tell them not to wear such helmets. They will ask them to wear standard helmet. What they do know, if we insist, they will directly allege that we are promoting a particular brand of helmet. They don't know ISI is a brand, that is a standard manufactured by any manufacturer, authorized manufacturer. This is how, that's why we started educating them. Enforcement definitely will do, because if we put all our cameras, ENPR cameras with AI, it will recognize off helmet as no helmet. Off helmet as no helmet, it recognizes. Man, which as a man, as an officer, which I cannot do, machine will do it. Machine will do it. Because it is the machine, the AI is according to IRC. What IRC tells, like that AI is trained, AI is in place in coming days. But as an officer, now we are educating them, we are telling them, in future you cannot wear such helmets. That is That is the thing we are doing.
Education.
With this, I congratulate Dr. Nishit Patel, Dr. Gautam, and Dr. Gururaj for their excellent work on this, and he is going to contribute more and more in coming days. Dr. Nishit, I congratulate you, and we should get big congratulations to that. Definitely, this road safety risk factors in Bengaluru is a very useful brainstorming session for all of us. When you are going to quantify something, you do something, you can do something. That's what the data is telling. Any data-driven research, any data-driven result definitely is going to show a path for improvement. Because you are quantifying something which we are talking so much in the past, in the present, and in the future also. These data-driven research will help us, particularly Bangalore Traffic Police, in terms of education, in terms of engineering, in terms of enforcement. Because, for example, speed, as rightly pointed by our Dr. Gururaj, always people tell, where is the speed in Bengaluru? But research is telling that you're traveling in an average speed of 45 kilometers. 45 kilometers. Even this is not possible in a village road. In Jilla Panchayat road, you cannot travel more than 45 kilometers. Here you are traveling average speed over the day. 45 kilometers, sometimes it is above 75 kilometers in Ovara. This is going to indicate us where actually we should do that such type of enforcement, speed limit enforcement. And again, I just shared this data with you. It is up to the researchers to take it forward.
Sure.
In May, 87 deaths happened in Bengaluru city, which is the highest. 2020 May, 2021 May, 2022 May, highest. Then it is really for us, particularly for me and for our officers, very painful. 87 deaths, that is almost 3 deaths in a day. 3 deaths in a day in May. Then we did brainstorming. Then in most of the cases, in 20 to 30% cases, it is drunk and drive. In the FIR also it is mentioned. Some FIRs, we are very magnanimous in pardoning victims. That is, we are always with the victims. Then we started everyday drunken driving checking. Drunken driving checking every day we started in June. For our surprise, the deaths have come down to 50%. This week, this month, we are doing this drunken driving checking. Almost we are reduced to from 7 days, 8 days, 7 days to 3 days to 4 days. We want to check whether it is really because of drunken driving or because of some other factors. In May, rain was heavy. Slush was there on the road. That may be the reason also. June, there was a little rain, reduced rains were there. July, rains are more. They're almost equal to May. All these, this type of research will guide us, guide the field officers, what to do, what steps we have to take in the future to reduce accidents and deaths. I'm really happy to participate in this. I really congratulate all the stakeholders. I thank Mr. Jnanendra Kumar, who is always supportive to us. I congratulate all the researchers. Dr. Pradeep for his excellent coordination and taking forward this. symposium or brainstorming session in a very fashionable way, and I congratulate Bloomberg Initiatives, John Hopkins University, and all the stakeholders. And I really appreciate my traffic staff who struggle day in and day out. They are the real heroes. And I congratulate once again Imams with these words. Definitely this type of data-driven research is going to guide us so that we can take a pragmatic approach to resolve the issues. I thank you one and all.
Thank you very much, sir. ಧನ್ಯವಾದಗಳು. ನಮ್ಮ ಸೆಂಟರ್ ಫಾರ್ ಪಬ್ಲಿಕ್ ಹೆಲ್ತ್ ಮತ್ತು ಡಿಪಾರ್ಟ್ಮೆಂಟ್ ಆಫ್ ಎಪಿಡೆಮಿಯಾಲಜಿ ಏನಿದೆಯೋ ಅದರ ಮೋಟೋ ಅಥವಾ ವಿಷನ್ ಧ್ಯೇಯ ಏನಂದ್ರೆ ಫೈಂಡಿಂಗ್ ಸೊಲ್ಯೂಷನ್ಸ್ ಟುಗೆದರ್. ಸೊ ಇಟ್ ವಾಸ್ ಆಕ್ಚುಲಿ ಕಾಯ್ನ್ಡ್ ಬೈ ಪ್ರೊಫೆಸರ್ ಗುರುರಾಜ್. ಅಂದ್ರೆ ಪರಿಹಾರವನ್ನು ಒಟ್ಟಾಗಿ ಕಂಡುಕೊಳ್ಳೋಣ ಅನ್ನೋದು. ಸೊ ದಿಸ್ ಸ್ಟೇಕ್ ಹೋಲ್ಡರ್ ವರ್ಕ್ಶಾಪ್ ಈಸ್ ಎವಿಡೆನ್ಸ್ ದಟ್ ವಿ ಟ್ರೂಲಿ ಡೂ ಇಟ್ ಆಸ್ together we find solutions. And final comments from Yanendra Prasad sir as one of the chairs.
Thank you very much for this research study made by NIMANS under the leadership of Dr. Pratima Murthy, Director of NIMANS, and with the support of Dr. Gautam, Dr. Pradeep, and a very charismatic personality, Dr. Gururaj, and with support of Dr. Nitish Patel from John Hopkins Bloomberg School of Public Health, and with the support of Bloomberg Initiative, partners of Bloomberg Initiatives. This evidence-based research report, it's a treasure for us, and it will be well taken for further necessary action and for further to take a further lead in this regard, because this kind of research will help a lot for further studies and to prevent what is our main objective of reducing the accidents and fatalities. Thank you so much for all the cooperation and for such kind of analysis made by the NIMANS, and we look forward for further analysis with regard to other that what is that evidence, other risk factors. So we look forward for further analysis with regard to other risk factors regarding road crashes. Thank you very much.
Thank you very much, sir. And we almost come to the end. Next person.
Yeah. So just
over to Gautam for
a quote of thanks. So while we sincerely thank Shri V.R. Ravikantewada sir for being a constant source of support, as well as Shri Gyanendra Kumar sir, Additional Commissioner and the Member Secretary of Karnataka Road Safety Authority, because these are sir was telling about the pillars of road safety. So these are also similar to the pillars of road safety implementation in Bangalore and also in the entire state. And we assure you, sir, NIMANS would give their best possible efforts to generate evidence pertaining to the entire life cycle, from the risk factors up to the end of trauma care management, as well as post trauma care management. Also, we will try to put in our best efforts and do a good job. I take this opportunity to thank all the partners from the Bloomberg Philanthropies Initiative for Global Road Safety, the World Resources Institute, Vital Strategies, Johns Hopkins University for giving us this opportunity to be a part of this larger initiative. And I have missed some names, but it's not intentional. And on the faculty from NIMANS, Dr. Hema and Dr. Dhaval Shukla, the neurosurgeon, also who has come out out of their busy schedule to participate in this meeting. So thank you very much. I want to thank all the traffic inspectors and officers from different ಕೆಪಾಸಿಟೀಸ್ ನೀವೆಲ್ಲ ಬಂದಿದ್ದೀರಾ ಇವತ್ತು, ನಿಮ್ ಸಮಯ ಕೊಟ್ಟಿದ್ದೀರಾ. ಸೊ ನಿಮ್ಗೆಲ್ಲರಿಗೂ ಲಾಸ್ಟ್ಲಿ ವೆರಿ ಇಂಪಾರ್ಟೆಂಟ್ to do this work. I would request our MDCs to stand up. They have been working from morning 7 to night 1. Kind of pillars of this whole data collection process. The postgraduates of the Department of Epidemiology, specifically Dr. Ajay and Dr. Azad Devyani, for helping us put this program together, as well as all the staff of the Department of Epidemiology, the project section, as well as the other related sections in demands. So, with the permission of the chair, shall we conclude the session, sir?
Please.
Thank you.
Thank you.
Please join us for high tea.
ಒಂದು ಗ್ರೂಪ್ ಫೋಟೋ ತಗೊಳ್ಳೋಣ ಎಲ್ಲ ಇಲ್ಲೇ ಒಂದು ಅಡ್ಜಸ್ಟ್